Nope. Anyone wants to make public comment? Okay, we will close that, and we have no volunteer interviews today, so we will call the Olmsted County Board of Commissioners meeting to order for December 2nd, 2021, and start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, we will start with the consent agenda. Approve the November 16th, 2021 board minutes. Proclaim December 8th, 2021 City, County, Tribal, and State and Health Human Services Worker Day. Approve the write-off of uncollectible DFO community corrections balances. Approve the write-off of uncollectible human services balances. Did I do that in the right order? Okay. Adopt and implement the Greater Zumbro River Comprehensive Watershed Management Plan. Approve street naming of Edenmore, or is it Edenmore?
Yes.
Edenmore Drive Northwest, doesn't matter anymore because now it's going to be called Tallgrass Drive Northwest. Approve street naming of Freedom Crest Drive, changed to Marywood Drive Northwest. Approve the joint powers agreement with the state of Minnesota. Approve change orders for the Oxbow Nature Center contract 20133. Approve 2021 donations received. Approve memorandum of agreement with extension. Approve intergovernmental agreement with the city of Rochester. Approve the liquor license for Jeff's Little Store. Approve the liquor license for Maple Valley Golf and Country Club. Approve the liquor license for Oak Summit Golf Course. Approve liquor license for Uncle John's Bar and Grill. Approve the liquor license for Douglas Saloon. And announce that the Truth and Taxation public meeting on the proposed 2022 budget and levy will be held at 7 o'clock this evening and online in the boardroom here.
Approve the consent agenda.
Second.
Any questions or discussion? All those in favor say aye.
Aye.
Any opposed? The consent agenda is approved. We now move down to the regular agenda. The first is the report on the 2021 annual Unsheltered Homeless Registry.
Good afternoon, Madam Chair, members of the board. Dave Dunn, Housing Director, here with several members of our team, Trent Flugel, Mary O'Neill, and Fernina Espinoza, who worked on the homeless registry with us this year. And we just wanted to take a brief moment and kind of provide you with some of the high-level summary results that we found. So just a little bit first about what it is. This is the third year that we've done this, and what it really is it's a biannual count of those people experiencing unsheltered homelessness in our community. This year we did it during the last week of July. Previously we had done this in October, and we kind of wanted to get a summer count in order to coincide with the national point in time count that happens in January. Also want to highlight that this wasn't done with just Olmsted County alone. There's 11 partner organizations that help with the survey and the registry work that we do, and multiple departments within Olmsted County. So briefly, I just want to highlight a couple of the key findings. And so the first one that I want to highlight is that we did see a fairly significant reduction in the people that we were able to identify. In 2020, we identified 207 people, individuals who are experiencing homelessness. In 2021, that number declined to 157. So that's a 24% decrease in the people that we've overall identified. Now, while there could be some outside factors because of the change in time of year, a couple of other things like that, we really truly do believe that this reduction in people that we've identified is heavily correlated to the investments that you all have made in housing for people who are experiencing homelessness. A little bit about the demographic makeup of those people that we identified. You can see there that 2/3 are male. You can see there that the race, and one of the things that we'll talk about later is that how specifically the Black population is overrepresented in our homeless count here locally. That's no different than a lot of other places in the state, but it just is something that we want to highlight. And then a little bit about the age breakdown. You can see there it's 61% of them are what I would consider that adult age group there from 25 to 54. But the second key outcome we want to highlight, and this is actually a correction from the packet, so I want to apologize for that, is that we saw a decrease in people who are experiencing homelessness for the first time. So in the 2021 survey, that number was 27%, which was actually a decrease from 40. We had a different number in your packet, so I apologize for that. And I'll get into a little bit of the why here in just a moment. But so as we're seeing here, I think that also helps us kind of understand the landscape and the lay of the land. The next key outcome, just to highlight, is an increase of people from outside of Olmsted County. So percentage-wise, in 2019, we were right around 70% of those people we identified were from the Olmsted County area. This year, that number dropped to right around 50%. So again, as you kind of look at some of the percentages and what's going on with the bigger picture, just to get an opportunity to kind of look at where people are coming from. And then again, the last key outcome there I want to highlight is the disproportionate impact of our underserved populations in homelessness. And you can see there that while our numbers are not good, they also are very close to what the state as a whole is. So when we talk about the issue of homelessness and unsheltered homelessness, we really are talking about something that disproportionately impacts historically marginalized population. So that's the numbers real briefly. I think the more important part is what does it mean? And what are we finding and what are those key outcomes that we found? And so the first thing I want to highlight is that this really demonstrates that the work that the housing stability team, the work that our partners across Olmsted County are doing is having success. We are moving people into housing. We are having success. We have housed over 200 people since we've started our work with the housing stability team. We've been really focusing on diversion efforts for those first-time homeless to do what we can to not have to get them into the system, but really building those relationships, really building relationships with individuals, because every individual experiencing homelessness has their own individual story. And so what we've really seen is that really because of twofold. One, the investments that you as the board have made in the housing stability team. And then the second investment is housing that we've had for more people who are vulnerable. So that last slide there, the last bullet point there highlights the 208 new housing opportunities for people who are vulnerable at that high risk category since 2019. So as we kind of look at, what solves homelessness? Housing solves homelessness. Case management solves homelessness. Those are two areas in which this board has heavily invested over the course of the last several years. The other thing I want to just highlight is that changing dynamics of the population that we're starting to see that are experiencing homelessness. So we anticipate now, as the eviction moratorium is ending, we're starting to get an uptick, and Mary O'Neill will be up here in a minute to talk, just to give a brief update on what we're seeing over at the Echo Center across the street. We're seeing that with community impacts of COVID and the eviction moratorium ending, we're seeing that uptick of that first-time homelessness start up again. And then the other thing I just want to highlight, and Mary can talk more about it and her team, but one of the things we talk about a lot is, well, what are those stories that you hear from individuals who come here? What brings people to our community, especially since we know percentage-wise that percentage that were previously housed outside of Rochester has increased. And so we really hear three things that are kind of the most common things. And the first one is economic opportunity. So people hear about Rochester, they know somebody who's living here, they hear about Olmsted County being this great place to live, and they just come. Now, when we have an opportunity if they call us, if they check in with us ahead of time, we give them a lot of information about while we would love to have you in our community, you need to make plans for it first and not just show up. But we see a fair amount of people that just come to our community that don't have housing lined up, that don't really know kind of what those next steps are for them, but just have heard of the economic opportunity here and want to be part of it. The second one is chemical dependency treatment. So this is one where we're continuing to work with some of our treatment providers here locally now that we've started to see this, to connect so we don't discharge people into homelessness. So if the treatment program doesn't work for them, let's figure out a way to get them to a place where they have a support system. And so we've started some of that work already. And then the third one there is medical care, which is obviously here because of the Mayo Clinic and everything else associated with it. We know people come from all over the world here for medical care, and for people who are experiencing homelessness, that's the same as for an awful lot of us. So how does this all impact our work that we're doing? I think the first thing I want to highlight is that we want to continue doing what's working. The investments that this board has made are having an impact. The investments and the time that our team is putting in are having an impact. So continuing to create those unique housing options for folks and continuing to invest in the case management needed in order to make sure they're successful. So we want to continue on those efforts. The second thing is kind of enhanced our focus on diversion. And this is really a big part of what the Echo Center is all about. We want to catch somebody before they really fall into that trap of homelessness and be able to divert them to other resources as quickly as possible. Hopefully to avoid it altogether, but if it's not, to make it rare brief in one time. And so really doing that, and then also building those relationships with the medical care community, with the treatment facilities. So again, when we have that discharge, we're not discharging into homelessness. We can create a plan proactively to get that person where they'd like to be. And then the last thing I'll just highlight is an upcoming piece of this puzzle, which we haven't talked about too much here yet, but really some new efforts around youth and family homelessness that will result here starting in July of an annual allocation of $600,000 coming into Olmsted County from the state to work directly with youth and family homelessness. And this came as part of a state bill, the last legislative session. And I just want to highlight too that Olmsted County was pivotal in getting this passed with our work through AMC, with all of your work through AMC. And they really helped, and we were able to be part of crafting this bill to be able to have resources that will be year after year after year, that $600,000 will be coming in to let us address some of those upcoming needs with youth and families that we know are still there and underneath the surface. So we're doing all of this, we're continuing to do what we do, and I think we're very proud of what we've seen so far. And with that, I'd just like to turn it over to Mary to give just a very brief update on what she's seen so far with the Echo Center.
So David, the 600K is built into the base now going forward?
That's correct. For 5 years right now it is, and then moving forward, we'll see where it goes.
Missed that.
Good afternoon, Commissioners. I'm Mary O'Neill. I'm the Program Manager for the Housing Stability Team. So this is our new logo at the Echo Center. You might recall that this is the space in the strip mall across the street here, right next to the Warming Center. So ECHO is short for Empowering Connections and Housing Outreach Center. So we opened the ECHO Center October 1st, so just 2 months ago. And currently we have 2 staff who are office there, Jake Radke and Trent Flugel. I do have just some preliminary numbers I wanted to share with you for the first 2 months. So during October, we had 33 visits at the Echo Center. And during November, that more than doubled to 72 visits. That represents 44 unique individuals who have stopped into the Echo Center, and all of them have been experiencing homelessness or housing instability of some kind, some facing eviction due to the moratorium ending. We identified 6 of those as being from out of state for the very reasons that Dave had mentioned earlier. And then 2 of those came from out of county and came here for substance use disorder treatment and ended up leaving that program unexpectedly with no housing available to them. We've had some partner agencies stop by and land at the Echo Center, which is our intention. There is an extra office space there. And obviously, they're coming to get connected to housing, but we're also helping them with accessing health insurance and SNAP benefits, getting that coordinated entry assessment, which is so important to getting people into our permanent supportive housing system. Another aspect of that is getting some referrals to our CREEK program, which is our extended 90-day emergency shelter program. So far we've really seen some success. A couple of quick stories. We've had 3 referrals to housing support within the last 2 weeks, and all of them have officially moved into housing support that we have confirmed. So that was a very quick connection. They came into the Echo Center, and because of Jake and Trent's knowledge of the system, they were able to get them into that housing. One individual of those 3 in particular is very well known to our community and has been homeless for an extremely long time. So we are really hopeful that that's going to work out for that individual. Another situation, one gentleman, young guy, came here with his mom for ongoing treatment in August of this year. Mom ended up in a long-term care facility, which will be a permanent placement for her. And the environment that they were staying in was really unsafe for him. So he chose to leave and ended up being homeless. They came here from Illinois, and we assisted with a bus ticket to get him back to Illinois with family. So again, he wanted to be with family. He had a safe place to return to, so a simple bus ticket got him there. And then one gentleman had received an eviction notice, which brought him to the Echo Center, and Trent facilitated him transitioning up to St. Paul in a long-term shelter program that will assist him with employment and other housing options. So 3 real success stories, well, actually more than that. But clearly this place has been, the numbers are higher than I expected, particularly just being open for 2 months. But clearly we're having an impact already. So thank you for your time.
Or how are they finding you? What?
More word of mouth. We definitely have put the word out to all of our community partners. They call our housing stability team line, and we will direct them to the address. But for the most part, it's just been word of mouth and connecting to that warming center. So our intention was to really have a close relationship with the warming center.
Were some of those of the stories that you told us first-time users of the warming center?
Yes.
That's
Yes.
wonderful.
Yeah.
Wow.
Yeah. Yeah. Thank you.
Thanks.
Thank you.
Very impressive. Thank you for all that work.
Madam Chair, I think it would be nice just to pause and recognize the hard work that they've all been doing to create these avenues of choice and pathways for people. It's been, I think about where we were 2 years ago, trying to sort through what our community response should be, what our needs were, how we would ever fund it. I think the staff have been extremely creative in listening deeply, partnering with others, helping the legislature see that they need to fund some of these services. And I think there's just a lot. You know, we kind of look at you silently. We don't necessarily call out or celebrate or shout out hooray, but it really is a kind of a situation where you've accomplished so very much. You're making a difference in people's lives, and it's not very visible to the community. It's one of so often with our human services things, when you're successful, whether it's public health or social services, it doesn't make the news, and that's the most valuable many times, and yet it's not something that the general public can know and celebrate with you. So I hope that you have some time to kind of celebrate among yourselves, since we don't do a lot of direct celebration, but really it's a very significant accomplishment. And our county is getting recognized around the state for our innovation and our commitment to housing. And whether it's, I see the Crisis Center folks here, the work that we're doing collaboratively in our own community, in our region, it's not us. It's not the people at this dais, it's you. And you really are very dedicated and very accomplished. And as a citizen member of this board, I could speak for many when I say we owe you a lot. And you should be proud of yourselves because you've accomplished a lot. So thank you.
Heidi?
Madam Chair, I wonder after those nice words that Dave and Mary would just introduce your other staff people who are here to the board.
Yes, of course. So Trent Flugel is here. You stand up, Trent. Yeah. And Fermin Espinoza is with our data analysis team. So he has been instrumental he's really embedded himself in the 3-day registry and actually helped with the survey itself to get a better understanding of it. So it's just those two.
Yes. As you all know, I usually end the meeting with a quote, but I think I'm going to use my quote right now because it actually fits with this team. It's by S.C. Laurie. A shout out to everyone who is trying right now, trying to do the right thing, trying to stay open, trying to keep going, trying to hold on, trying to let go, trying to find their flow, trying to stay afloat, trying to meet the new day, trying to find their balance, trying to love themselves, trying new things and new ways. We see you. We're there too. We're all in this together. Yeah. It's invaluable what you do for our community. Thank you. Okay, take a breath. That's wonderful. Administrator Showcase, Health, Housing, and Human Services.
Afternoon, Commissioners. My name's Amy Thompson, and I'm the Director of Adult and Family Services. And I brought a few individuals with me today to help highlight CIRC, our new regional crisis center. I have Tim Hunter. Many of you have met Tim, is the CREST Regional Coordinator. Nicole Muchik is the Executive Director of CIRC. And then they brought two folks with them, Christina Darrington and Karen Tracy,
You can come up.
which are both peer support specialists through our Southeast chapter of NAMI. And they bring a unique perspective and support to the individuals being served at CIRC. And so we asked them to come along and share a few words with you. So over the last year, I've had a few opportunities to come before this board and highlight the work at CIRC. And really want to talk today about how we've been able to move from vision to being fully functioning. This really was a collaborative effort from the start and frankly, years in the making. And while we've talked about many of those who helped us get to this place we're at today, I want to highlight a few of the folks that we maybe haven't had the opportunity to talk about that have done some of the work behind the scenes. So I want to start first by mentioning our 10 Southeast Minnesota counties, because as we know, CIRC is a regional resource, Mayo Clinic, Olmsted Medical Center, and we have 2 health plans that have really stepped up and helped contribute. That's UCare and Blue Cross Blue Shield, and then NAMI of Southeast Minnesota, all who have contributed really to helping us minimize barriers to individuals needing to access our mental health services here. I want to do a special shout out to Matt Miller and Zach Wood, who really, and our whole facilities team, who really helped throughout all phases of the construction process. And I think, well, we all know that construction can be challenging. COVID provided some additional complexities that they had to move through, and they seemed to take it in stride, and also did a really nice job helping communicate with the rest of the county so we knew where we were at every step of the way. I also want to highlight Brooke Carlson. As folks know, she facilitated countless meetings with stakeholders throughout the time that we were working on this project and really helped keep everybody on track. And Tim Hunter and Amy Becker, both behind the scenes every step of the way, and instrumental in really getting this stood up and operationalized. And we have lots of other partners, from community providers to law enforcement. And I also want to highlight you, our commissioners, who've not only supported bringing this local resource here, but have recognized the need for mental health services that frankly go beyond the crisis center by continuing to support our need to expand our behavioral health continuum in Olmsted County by supporting some of the work we do in adult and family services and your investment in our newly expanded community outreach team, the DECO team in corrections. And lastly, I want to highlight Nexus and Nicole. Nexus, as you know, is our operational partner, and while Nicole is new to our community, what she's already been able to do to stand up with getting it fully licensed and credentialing, how she's helped support staffing, hiring, and all the challenges that I think come with operationalizing a brand new program has been quite incredible. It's been open for about 4 months. So I'm excited to pass this off to these folks to help provide a snapshot of where we're at the first 4 months in. So,
Thanks, Amy. Is our clicker forward? Got it. Maybe.
This is the only side that's important.
Oh, yeah. It's not moving forward.
It's a little.
There it goes. So we just wanted to highlight here, thank you again for having us and to be able to talk about the Crisis Center. As Amy mentioned, it's been quite a feat to bring it to reality. And we're so excited that we're 4 months in. So we're hoping to highlight today some of those collaborations, as well as some of the data points that we have that we can bring to you. And then some impact with our members from our peer support specialists from NAMI. So one of the big things that CERC has really been able to provide to the community is that ability to bridge service gaps. With the way that services are aligned at CERC, we are able to bridge some of those gaps in the mental health service continuum. And that's been a really unique service that we've been able to offer. But also we've been the front door for many individuals who are first-time users or accessing mental health services. So in that way, also that's brought a unique piece to CERC that we've been able to help establish individuals with outside service providers once they come through the doors and access services for the first time. So with this slide, we really just wanted to highlight that collaboration where some of our referral partners are coming from to CERC. And then that ability for us to collaborate with outside providers to get individuals out ongoing services. And then that continuum kind of circles back at times. So what we'll highlight is some of our unique individuals that have been coming into CERC, but some individuals have come multiple times. And we are okay, that is perfectly fine, that individuals may access the service multiple times. And so that we can help provide that collaboration then back out to outside service providers and have that continuum of services that continues. So to highlight some of that data, there's 272 unique individuals that have come in to access services at CERC, and 118 of them have accessed our residential services. And now these are unique individuals, so some have accessed those services multiple times. We've made 233 referrals out for community stabilization. So that's back out to our mobile response teams to provide stabilization out in the community to individuals who've accessed the Crisis Center for a mobile response. So for that community response service in the clinic. Our average length of stay in residential is about 5 days for adults and 7 for youth. And we have about 54% of our individuals that are accessing the center are receiving medical assistance. One of the great partnerships that we've been able to establish with regards to benefits is working with the MNsure navigators to help individuals access and set up insurance benefits. So individuals are coming in and they have no insurance, and we're helping get them established, and they're leaving with some form of insurance when they leave CERC. So that's been a great partnership that we've been able to establish. With Olmsted County currently is about 62% of the individuals that are accessing the center are from Olmsted County specifically.
Well, good afternoon, commissioners. Tim Hunter, obviously Regional Program Coordinator. I always like to highlight why we started this project, and that goes back to those experiencing mental health services and mental health symptoms, and the ability to have a center available 24/7 for anybody who's experiencing a mental health crisis. That is more important now than ever. And so what I put in front of you is actually the continuum of mental health that somebody may feel, right? Everything from excelling and doing well to being in an actual crisis. And one of the things I'm proud to say is that we now have a facility that's able to meet anybody where they're at. And what we've seen is people are accessing the center on all parts of this continuum. For people looking for resources really early on, excelling, to people in an absolute crisis that need to get somewhere else. And so as we've done this work and as we've kind of highlighted here, the partnerships that we've forged through this really make this a reality. And what we're seeing both here locally and as a state, and I'm sure you've heard it from your colleagues in other parts of the state, is we've done it well. And we've developed something that actually creates access for people with very few barriers. And so I know I get calls, well, probably at least weekly, looking for advice on how to do this across the state of Minnesota. And so I want to thank you for your efforts in that, but also know that it's being noticed and that we're doing it well and we're meeting people where they're at and then getting to the correct part of the system. And so thank you for that. And I always want to kind of highlight that as we talk about CIRC and what it's done in a very relatively short period of time.
So my name is Karen Tracy. I'm with NAMI, Southeast Minnesota. And I want to talk a little bit about what is actually peer support, right? Peer support is a specialist, is an individual who has their own lived experience with a mental health challenge, finding themselves in a good place on their own recovery journey, that they have received special training and support others at this time. Mental health peer support is an evidence-based model of care. It has been demonstrated to reduce symptoms, create commitment to treatment plans and goals, improve peers' quality of life, and lower health care costs. That's the main goal, right? Is to lower our health care costs these days. As a person who has traveled a similar path, a peer support specialist fosters hope for recovery, a model of reality of wellness to the peers that they serve. And I think the greatest opportunity I have now is to help with CIRC. What I have learned to give them hope that you can recover from your mental illness and how to do that journey. It's not that we fix them, we go along with them on their own journeys. With that, thank you.
Yes, and I'm Christina Darrington, also a peer support specialist. I have been with CIRC since the beginning, and I have seen the wonder that it has been. Like Karen said, that we're showing that hope for recovery is possible. We have walked the walk. We have had similar struggles, and we've come out the other side. I had one client actually say that I provided hope. We were of similar age. This client was feeling defeated, like life should be more figured out by this point, and it's not too late, and I provided that hope. We've provided collaboration with other CIRC staff. They have an awesome staff there. We go back between the clinic and the residential side, can kind of bridge the gap sometimes, and kind of tie in loose ends with information to help best serve the client. And help with community services, whether it's support groups, programs, even future peer support within the community when they're back in there. You're even help fill out medical assistance paperwork. We're able to do that. And we've seen firsthand the importance of CIRC in the community. Seen people, myself, that one particular that was out in the clinic side during assessment, I spent hours out there and seeing this client just thrive during the 10 days in residential. Went from being scared and just broken almost, and was just feeling life was helping other clients in residential, even being helping the staff, and was ready to go by the end of her stay. So I've seen it firsthand. Thank you.
And so obviously with everything new and everything that's been existing, there's always going to be challenges and opportunities. And the one great thing I would say, being this early, is that the challenges that we're seeing at CIRC and other parts of the system are not new, right? There are workforce shortages, there are demands of symptom complexity that we're seeing, and people are coming in, but people are receiving services in real time and being able to triage that. And so I always highlight that, even though this is a great step forward, that we're always, as a behavioral health landscape still challenged and will be for a while. But one of the things that it's done in a short period of time is it's actually given us a way to look at opportunities, right? Even though we're facing these challenges now in real time and with some actual experiences under our belts, we're now able to look at this and say, how can we work to improve these challenges and kind of continue that work on the system as a whole? And so as we look at that, we're always continuing to find some of those solutions. And what I would say is, you're really advocating on both the state and federal level, giving us some opportunities and some data now to say, here's what we need, and here's how we need to drive the system forward. And the other thing we're doing is we are creating more pathways and forging different partnerships. We've had great partnerships that got us here, but now with DECO online and those, we are continuing to formulate those networks across the region, across the state, that are really helping get more people served in a short period of time. And then again, we have now more of an ongoing narrative on mental health. And over the past 2 or 3 years with this project, I've probably spoken more to county boards and others about mental health and where we need to go. And I think that's a great opportunity as we kind of move the system forward, and it's just good work. So with that, I thank you and appreciate your time.
Thank you.
Well, thank you.
Chair? Yeah, they're still here. They called out the need to, well, let me just say, the crisis service was visited by the Senate Bonding Committee recently. And you were there, Madam Chair, and I was there. And Senator Senjum's really committed to this and committed to using the Olmsted model to help other communities across the state, including with some bonding. But during that conversation, or sometime during that day, you made us aware that children's services are not covered under medical assistance. And I just wanted to let you know that I heard today we've tried to advance that now into the legislative platform. And I heard today from Jennifer Berkram, our legislative liaison, that it is now part of the MICA platform. And also, because of your work, had an opportunity to bring it up to when the Association of Counties worked on its platform this week to talk about that need. And overall, in the Association of Minnesota Counties platform, the number one thing that counties across the state are saying, there's two things they're saying. One is, we need a mental health system that has an actual continuum of care. So that's number one in terms of mental health. Then probably even higher than that, but it affects mental health as well, is the chronic shortage of workforce that is now causing residential care facilities and other facilities not to be able to close. We heard yesterday from our own staff that we have, with commitments, the state hospital is not taking as many patients as they have beds because they don't have staff. It's sort of creating this whole backlog in the system. But this is a shining star that we were able to get this program developed and have a local legislator be a champion and have the staff who now knew how to build a collaboration that's hard to do among counties, and find a good vendor. And it's with the peer support people, this is a really big accomplishment that is being modeled elsewhere. He told us there's 8 or 9 other communities, Senator Senjum did, that are looking to replicate this model in their communities. And so I would anticipate the people that are before us today will be asked to consult and confer, and to spread the model and the process to get to this kind of model. So anyway, it's a we have 2 examples today of the kind of innovation, the kind of dedication, the kind of problem solving that our human services staff do and why they're exemplary. It's just exciting.
It is. When I think about what you're doing, I think about, well, what if I was one of those people walking through that front door? And what I thought was that I knew I would be treated with kindness, and I knew there would be people there who would help me see the possibilities of my own potential. And someone who volunteers their time and their care, that's powerful healing. And I'm just so touched by all of the creativity, the kindness, and the compassion of all the people that are in this room here today and what you do. So I hope when you drive home tonight and you drive through this community, You just look around and think, this is a better place because I work here.
That's great.
Yeah. Thank you so much.
Thank you.
This is very emotional and moving, these reports. All right. Excuse me, I'm going to say this wrong. The Parks Master Plan.
Good
afternoon, Chair and Commissioners. I'm Carlin Ziegler, Olmsted County Parks Director. I am going to go through this as quickly as I can and give you enough information. It's a lot of information to throw at you at once, but it's a lot that we've accomplished in the last 5 years, and we're starting to update our master plans every 5 years. And so this is the first cycle of updating the master plans since we have developed them. So I want to just go ahead and start with our Chester Woods. First, I'll show you the things that we've accomplished in the last 5 years. They have been moved to a separate page highlighting those projects in the master plan. So we have completed the Legacy Trail, which is a place for respite and for dedications. So it's a small area near the office, closer to the park entrance. We also improved the boat launch area and improved and expanded the parking lot area at the boat launch. We created an on-leash dog area within the parks, and we also created 2 remote camping sites across the lake that are only accessible through canoe and watercraft. You can also see some of the pictures to coordinate with those off to the side, including the pathway in the lower right-hand corner is actually leading down to our new watercraft rental area, which we moved to the beach area. So it has its own kiosk window in the bathhouse as far as getting the rentals taken care of, where the rentals are stored, and it removed that from the boat launch area and helped with congestion greatly this summer. So that was a nice addition.
What's the fenced area?
That is a dog area where they can go down to the water's edge with their dogs off a leash and practice water retrievals with their dogs. So it's an off-leash dog area just down from the campground.
Can you tell me a little bit about how someone uses the Legacy Trail?
It's a very small trail. We just added to it this year, but really it is just a small area for sitting, a very small trail that walks around, and then it does have several memorial or dedication areas with names of those who have been dedicated to that area and made donations to the park. And so there's benches to sit at. It really is just a place for respite in the park. We have added now a bridge that goes across to a trail, which takes you then further into the park. So it is now connected to the rest of the park trail system, whereas before it was kind of its own little place that is now connected to the rest of the park system. So it can also serve as a little bit of a trailhead area.
Thank you.
Maybe it'll go. Maybe not.
You broke it.
I did.
Well, that was a nice report. Thank you.
Okay, that's it. Just Chester Woods. All right. So in the master plans, really our focus on updating everything is what we've done and what our plans to develop the parks are. So the next section I'll show you is the development of the master plan. So continuing on at Chester Woods, we do still hope to develop a visitor center and trailhead facility at the park. We are going to be connecting a DNR trail into the park system, and that is actually going to start next year. It was anticipated to start this year, but they did have some setbacks. So their trail will start within the park next year and work its way out and back to Rochester. So we'll see some progress right away next year on that DNR trail. We also would like to see a rustic family disc golf course. The City of Rochester is building many executive style disc golf course. Ours will be much more family and novice oriented. But
bigger baskets?
Yes, bigger baskets, yes. So yeah, it is something that we see is definitely up and coming. And so we want to get into that trend of the disc golf courses. It's not a big maintenance type amenity. There's other recreational small area games that we'd like to throw in there. Eventually, we would like to get a bridge over to the East Peninsula. That's an area that is very underutilized right now that could be used more heavily for trail systems and potential areas over there. So as soon as we figure out how to get a bridge across there that's not going to give everybody a heart attack with the price, we will come back with a plan on that. We want to keep expanding the campground, including some camper clusters. Man, that one's hard to say. A cluster of camper cabins in another area really close to the campground, but the camper cabins have been really, really popular. So we know we want to expand that area as well, and then always continue to maintain our trail systems. We also have the amphitheater scheduled for 2022 and 23. I just received word that we have been put on the recommended list to receive the legacy funding for that. So we have $380,000 in legacy funding that should be coming our way next year. So we will figure out the coordination of what we want to accomplish in the fall of 2022, and the rest of it will be constructed in 2023. So that will be a really nice addition to that park. And then we also have some plans for additional children's nature play areas within the park. So in all master plans, maps were updated. Typically in each one, something major had changed that we needed to update all the maps. In the Chester Woods map, it was the DNR trail system that will be up and coming. That was a larger change within this park. So all maps were updated and changed within the master
Is
plans.
the DNR trail from the west edge of the park? Is it using some of the existing park trails, or is it a new trail through the park? It goes to the north.
Yep, it's going to run the line along coming into the west entrance, and that lower portion of the north side of the park will run directly along the. Does this have a laser pointer? It doesn't. It'll run along the border, and then it will tuck in just a little bit and use the existing trails, and then connect with, again, another existing trail, the Dam Overlook Trail, and then work its way to the parking lot.
So it's now a combination of new trails using some existing trails connecting to within the park, and then new trails east.
Yep.
Okay.
Yep, and we're just really focusing to make sure that we're some of our horse trails are getting shifted just a little bit so that we're not overlapping bikes and horses, and the user groups should remain happy with how the trail systems are working out there.
So you got mind one more extraneous question. Are the horse trails used very much?
Yes, they are. We consistently see horse trailers there on the weekends, sometimes during the week. We have about 250 bridle passes, annual bridle passes out there. So yeah, they are used.
Thank you.
And that trail will continue on to Iota then, is that?
Yes, it'll eventually go on the other side of the park and continue on to the roundabout by Iota, and then go up to Plainview.
Okay.
And also out to Whitewater. It will kind of split from Iota, go to Whitewater, and then also up north to Plainview. Is it working for me yet, or are you just doing the handiwork for me? Okay, perfect. Okay, so just a snapshot of the short-term, midterm, and long-term. Again, short-term is 1 to 5 years. You can see on the map, anything in red is going to be a short-term goal. So the short-term goals at Chester Woods, again, are the amphitheater, which you can see pictured on there, should be completed in the next couple years. And then some of our smaller recreational areas, things like Gaga Ball, the cornhole, permanent cement cornhole structures, smaller recreational games like that will also be part of this. And then again, we'll always have the wayfinding, the benches, lighting, things to make the park a little bit more user-friendly, or updates within the parks. Then we move to our midterm goals. Midterm goals are going to be highlighted in green on the map, so you can see approximately in the park where those are located. In the midterm, from 6 to 15 years out, we will have the rustic family golf course integrated into the park. We would like to see the visitor center built at the entrance of the park, and that will now that we have the DNR trail system coming in, will serve as a trailhead facility as well as a visitor center, and just kind of that building right there at the front when people come in for questions. That will include some parking lots to go along with those new buildings. And then our long-term goals, anything farther out, 16 years plus, you're going to see as blue on the map. And at Chester Woods, that includes that bridge across the peninsula, some design work within there that we can start working on in the more near future. The natural play area that we see along with that peninsula, as well as the trail system over there. That camper cabin cluster, I'm getting better at it, but it's still a tongue twister. That will be something that we would like to see, but will be a little bit more long-term, and other trails and updates within the parks as well. So some substantial amenities that we're still looking at very long-term at this point. Okay, so then we move on to Oxbow Park. So a lot of the accomplishments we've seen in the last 5 years at Oxbow Park, including the new access road. So that road is now complete into the park, the new alignment. It looks really, really great. If you haven't had a chance to go out there, it really changes the way you enter the park. We have a really nice, big, huge limestone wall that you drive past with already some springs seeping out of it. So you have that fun waterfall seepage effect as you drive into the park. And fingers crossed, it's nice and up and out of the floodplain, and we don't have to do all our annual repairs to that road anymore. We have the new Nature Center parking lot and the new Nature Center underway. So we are including the Nature Center itself as somewhat of a considered completed project as far as this master plan is concerned. Our phase 2, we're going to consider still needing to be done in our master plan, because that's not going to start until the summer of next year. So phase 2 is all the entrance plaza, the demolition of the old nature center, and some other outdoor landscaping. So the nature center is in here under a completed project. The historic Hellickson house was removed. We originally thought we were going to try and renovate it and save it, but it proved to be too structurally unsound to be able to save without putting significant funding into it. So we did get approval from the original owners to take that house down. We saved remnants of it that we can hopefully do some exhibits with in the future. Another nice accomplishment was Doc's house, finding a resident for Doc's house. We have now Doc's Recovery House, utilizing that house, and they lease that out from us on a yearly basis. But again, they are a chemical and dependency recovery program that's based here in Rochester, but they're using Doc's house as like a field trip and day use facility. So they have been working on the house. They've been working outside of the house and volunteering within the park and using that facility, and that relationship has been going really smoothly. So it was nice to have Doc's Recovery House in place at the park. Also, you can see a couple of other pictures in there that were just a little bit smaller projects. We have some overlooks that have been put in place by a couple of different organizations that donated the funding for those overlooks within the park. And we also had updated the prairie dog and badger exhibit in the last couple of years. So that was our newest zoo exhibit that we have accomplished. And we do have prairie dogs back in again. So they're back and they're up and they're scrounging around for winter. So if you want to see prairie dogs, you can head out there. Still to develop at the park, we want to continue working on the access and the roads within the park. Eventually, we'd like to move the rest of County Road 105 closer to the zoo, to a location closer to the ridge line, so that we can move all of what we call the hoof-stock animals, which is the bison, elk, and deer, to be contiguous with the rest of the zoo, so visitors don't have to go across the road in order to see all the animals. They can stay within the zoo in one place. Also will help with additional flood problems in portions of that road. The Path of Imagination is just a continual project that we'll work with. Sometimes we're changing out exhibits, maintaining what we have in there, but that's just kind of an ever-evolving area that we want to keep on our radars in the master plan. We have some designs for a new campground facility. We want to continue moving forward and getting the campground up and out of the floodplain. So we're working on plans for a new campground facility, which would be increasing from a 30 site to a 50 site campground at Oxbow Park. We're also going to continue, as we did at Chester Woods, to continue to work on the trails and maintenance, incorporating new trails as we've developed different areas and acquire new land. And eventually we'd like to replace all 3 bridges in the park. Right now it's not very easy to access the area of the park that's across the river where most of our trail systems are. So in emergency situations that gets a little tricky, but it also gets tricky for maintenance. We have to go very long ways around the park. So we want to improve those bridges so that we can at least get some larger equipment across and not just be walking across those roads or the bridges. Okay. Also improving river access. Our river access, now that the new road is in, has moved. It was in that Caulfield picnic area, which was the very first small area, and it has now moved to the main picnic area. And we can also improve some access to the river at our second bridge picnic area and potentially where the campground currently is located. So there is additional potential for river access points. The Zone Zoo and Nature Center, we're always going to be looking to update exhibits as they age or animal needs change or the configuration of the zoo changes. So we're going to be looking at those changes as we go. Also looking at an on-leash dog loop area, we would see that if we get the land acquisition in the future, if we get additional lands, we would be looking to incorporate those on-leash dog loop areas within the park. And then always increasing our interpretive elements and programming within the parks. So at Oxbow, the updates to the maps reflect a lot of the road changes, but also reflect some border changes. We did have some additional land purchases in the last year or 2 that we wanted to reflect the new borders of the park within all of our master plans. So every map is updated within the master plan as well. Okay, short-term goals, again, are in red on the map, mostly in our highly developed areas of the park. You will see that we are going to get a new caretaker's house. We will be in a new location. The age and repair needs of the current caretaker's house kind of exceed what we would like to see as far as the value of the house versus how much needs to be put into it. Our caretaker's house will be moved back almost behind the zoo by our third bridge picnic area, which will actually be right outside the zoo fence of where we call our high-risk animals, our cougar, the bear, those animals that need a little more watchful eye as far as the zookeepers are concerned. So that house will be moved. We will demo that caretaker's house as well as what we call our dorm building, just a small brick building in the center of the zoo. And we will do that second phase of the Nature Center, which is that entrance plaza to the zoo and demolition of the current Nature Center. Also in the short term is the campground. That campground will go up in and out of the floodplain directly across the road right now from where our deer, elk, and bison are located. So it'll be across the road from that in that open field. Okay. Midterm goals, again, 6 to 15 years out. We're looking at realigning the County Road 105. We've been working with the Public Works Department on their planning and timing of that road. And so that landed in the midterm goals of our map. When that happens, there's a whole lot of other domino effect that happen as far as the zoo exhibits changing around and the whole configuration of the zoo boundary lines and exhibits there. So that will fall in line with that. And utilizing the old campground, determining the use for that and any changes and fixes to that area that we need to determine in the old campground area. And then we have long-term. Our long-term goals are, again, really just focused on whether or not we're going to acquire new land. We have several landowners who are interested in selling us their land at some point and giving us first right of refusal, but they're just not ready quite yet. So we have a good working relationship with them. So it is more dependent on when we get that land as far as any improvements that might happen. So that would be more trails that come along with that. And then our bridges are also in that long-term section of the park. So any questions on the Oxbow Park master plan? Okay, all right, then we'll move on to the last one, which is Root River. So Root River completed projects. We did some prairie restoration. We worked with Pheasants Forever and restored 17 acres of former pasture land into habitat areas with Pheasants Forever. And then we also, just this last summer, restored the old Stagecoach Bridge. We did a lot of repair work on that. We got a lot of staff there several days and really rehabbed that entire Stagecoach Bridge. So it is in really good condition and looks really good right now. So that was accomplished just this year. And then we did remove the former residence house as well, and just prepare that space for future use.
Did you have to work with SHPO on the bridge, or were we able to do it?
No, it is not on the historic
Not on their
registry.
list.
So
Don't put it there.
We didn't tell
yeah.
them.
Nope, not on
Your
the
own
registry.
color of
But we
Resist
did a good
mortar.
job of restoring it accurate to what it would have been with the correct type of limestone and structurally how it would have was
Jeff
built.
did that work, or did we do that under contract with someone else? Did we do that?
We did that in-house. Yep. Goes back to our very talented staff and all the many talents that we have within our small staff. We're able to do a lot of projects in-house, which is always fun to be a part of as well. Okay, so future development of Root River is additional picnic facilities, more access to the river. We want to put up an event pavilion that could potentially be a 3-season pavilion, but the event pavilion right now is scheduled to be in the place of where the old residence house was. It has a fantastic view, and it's a really great positioning within the park. So an event pavilion out there would be, I believe, very heavily used. We are working on the apiary and research. We're working with the U of M and continuing the relationship with the U of M on the apiary and bee studies and beekeeping within the park. Caretakers and maintenance facilities, there may be some changes to those areas depending on how long the current caretakers decide to stay and the facilities and changes that we need for maintenance out at the park. Natural resource improvements, we'll continue to look at the forested areas, do some cedar relief, forestation and that, and restoring more prairies within the park. Okay. And then again, updates were made to all of the maps because we had a 1 acre change in our border. So that 1 acre change was just the very, very tip of the park down on the bottom right-hand side. Originally that was part of DNR land across the river, and so we acquired that little 1 acre tip from the DNR, so now we have contiguous boundaries with the waters of the park. So that one change required all map changes. Short term, in the next 1 to 5 years, we would like to have a picnic shelter built in an upper shelter area a little bit further into the park that would overlook, again, it would be right on top of the ridgeline, so it would overlook the entire scenic view of the park, but be very accessible to everyone in that area. And also, along with that, building a natural playscape area and playground to go along with that area. And midterm, 6 to 15 years out, is where that event pavilion lands. We'd like to see that again in that area of the old caretaker's house or the old residence. And we'd also like to incorporate in one more picnic area, just a level down from that, just down the hill halfway through the park. It would be on the ridge line. So the terraced picnic areas, you can see a small picture of what that might look like, just as a set of 4 terraced picnic areas with just the picnic tables and a few little amenities with a small parking lot down in that area. So those are the midterm plans. And then long term, again, one more step down to the very basin of the park for another terraced picnic area, just a small, modest picnic area right down in the floodplain areas just above it. So it won't actually flood, but really nice and close to the river at that point. With just a small cart path going down to that road, not any major developed roads or anything going down there. It would be more of a hike-in picnic area at that point. And so that's kind of our long-term goals. I wanted to leave you with a picture of where we are at today with the Oxbow Nature Center. Construction underway, and the framing is going really well at this point. So this is what the building looks like from the parking lot area. So you can see the three different sections of the building. We have the admin area to the right, and the programming area to the left, and the big space in the middle is where we're going to have our big exhibit hall. So it's fun to see things coming together and see a building going up. So it's nice for public also to see some progress happening out there. So again, just a reminder that the park master plans will be updated in this fashion every 5 years, approved by the Park Commission, and then brought to you for final approval. So,
Question, Carlin, the event thing at Root River, what size footprint are you looking at for?
We
something
haven't
like that?
quite determined a size. I think as we get closer, we'll see what other facilities are available. But within our Parks Department, we're going to have the Nature Center. We'll have Grand Park facilities. So it'll be kind of looking at that to see just how big of an area we would need. I wouldn't anticipate it maybe being any larger than what we have in the Nature Center, the current nature or the News Nature Center, which would be maybe 100 to 150 people max for events out there. So
I assume around River we don't have property owners who are looking at us, either the DNR or other private property owners.
at this point, we do not have any of those positive conversations towards land purchase in the future. But it's something, obviously, if people approach us, we will consider that along with the DNR land. And we did have somebody approach us a couple of years ago wanting to sell their land, but it was more closely connected to the DNR land and not connected at all to our land. So we just forwarded them to DNR as a potential buyer instead of for us. But we will certainly entertain anybody that's willing in the future if we're connected to them. But at this point, we didn't want to highlight any particular land in our master plans so that people understood that we don't have any our minds on any one particular piece of property at this point.
Might get somebody excited if it started.
Yes.
Red t-shirts.
Carlin, are these plans, how would the public find these master plans?
These plans will be posted on our website, on the park pages of the website, so everybody will be able to view these master plans.
And so you update it every 5 years. Will you be making any changes in the interim on that website, or is it
Probably
stay?
not on the master plan document itself, but within the parks page, we may add a couple of narratives to say that we have completed this project. But it takes a little bit of time and effort with consultants to update the master plans.
Sure.
So we'll just kind of compile everything and.
Very comprehensive.
Thank you.
So, Madam Chair, do you need a motion to approve?
We'll bring this to you, the board on the 14th for a consent agenda item.
Consent agenda.
This was more of an informational.
Madam
That's
Chair?
a discussion decision, so I wasn't sure.
Commissioner Wright?
Just want to compliment the park board commissioners on this as well. Carlin works really well with the park board itself, and I know from the experience that my time on the park board that past members and current members are extremely avid outdoors people and really watch out for the parks and have added a lot of enhancements to the suggestions for the parks. So they deserve a lot of the credit as well as working on this as a volunteer group. And it's always interesting is that Olmsted County always imports people from other places, and we have park board people that were experienced in other states. And other states don't have some of the ability to have public parks like we do, and have helped us avoid some of the issues that other states have entrapped the parks in. So I think it's really good. And I also compliment Carlin because she did wind her way through several very difficult negotiations with a variety of state agencies. So thank you very much, and we're in a better place for it, Carlin.
Thank you. And many of the list of accomplishments are in part due to you and your support for the parks. So we appreciate you supporting the parks and our improvements.
Thanks, Carlin.
Thank you.
Moving on to something we've never heard of.
New topic.
New topic, yeah. Madam Chair, Commissioners, I'm Denise Daniels. I'm an Associate Director with Public Health. I have with me today Megan Sheridan. For a good portion of the pandemic, Megan was our lead epidemiologist. And for the past few months, it has now been the program manager over our epidemiology, surveillance, and preparedness group. So thank you for your time this afternoon. We're actually going to provide an update today on COVID. So first things first. If you haven't heard, there was headlines today that we have the Omicron, make sure I'm pronouncing that right, variant that has been detected in Minnesota. That's the newest variant of concern that is now raising its ugly head across the world. We're lucky here actually in Minnesota that MDH has a really strong surveillance program and laboratory where we were able to detect this early here. There's really not a lot we know about it yet, so we're staying the course, staying vigilant. What we do know is that the same mitigation strategies are the ones that we'll promote with vaccines, boosters if you're eligible, masking, in crowds, washing your hands, staying home if you're sick. So the same mitigation strategies that we've always had. So next, actually, Megan's going to provide you guys with an epi update, some of the surveillance that we're seeing, and then I will finish with just the state of where we're at right now in public health with our response efforts. So, Megan?
I was joking with Lisa. I had to redo that slide 3 times in 2.5 days because but that again is where we are too with, it's kind of, who knows, we could walk out of the board meeting and, well, there could be another state that's reporting their first case. But so what I'm going to do is just going to be giving you guys an update on our current, looking at the United States, Minnesota, and then Olmsted County, because I always think it's important for us to look broader and then scope down. So this is the level of current community transmission. I'll be honest with you, this graphic hasn't changed a lot in a really long time. Sometimes some areas in Florida pop up as low, but then they go right back to moderate. So I think a big thing to know is we're kind of in this flux right now, where we're seeing a lot of different states riding out these delta waves. And again, now moving into the winter season, moving with potentially opportunities for more variants, people getting sick of wearing their masks and different things. I think we're all kind of just holding our breath a little bit to see what the next few weeks, especially too with the holidays coming around, will bring for us. I will say Minnesota finally has kind of gotten knocked down from their #1 spot for the biggest hot spot in the country. New Hampshire and Michigan have taken that from us, which I'm okay to give that up. So what we are seeing though is from week to week, we're seeing these big shifts. So I think that's where, and even our health commissioner too, is we're starting to see some positive trends here in Minnesota, but it's going to take a little bit for us to see where we're really at.
Hey, before,
Yeah.
what's the orange thing that's below?
Guam.
Guam, okay.
Oh.
Yeah. I'm glad I could answer that question.
Ken couldn't answer it.
We took a couple of
Rochester
shots.
Rochester Public School education
There
right
you
there
go.
for you.
Looked like a misplaced puzzle piece.
All right. If I'll take any more questions, geography-based questions.
All right.
All right. So now, kind of looking at where we are as a state. Like I said, this week the state started to report some positive trends. We have been, as you can see with the graph on the right, really more in that upward trend. We're starting to see a little decline. What I want to caution everyone is across the state and even here in Olmsted County, due to the Thanksgiving holiday, we saw a dramatic drop in testing. So there is a little bit of a dip, and I do think there is a true dip, but it's probably not as drastic as what we saw. The other interesting thing I thought was, so last week, if we look at the MDH report they put out every Thursday, compared to this one, they changed their color scheme because the old one just looked super daunting because the entire state was black, basically, with our incidence rate. So they changed up the color scheme. But basically, it's this. I really like this graphic because from week to week, you can kind of see the progression. But it also helps us. I always think too, it's always good for us to understand Olmsted County in relation to Southeast Minnesota, but then also in relation to the state. Dodge County actually had the 4th highest county incidence rate in the country last week. So you can see there in that dark blue. Here in Olmsted County, like I said, they've changed up the scaling a little bit, but we actually have been fairly consistent, if you will. The other key things for Minnesota, like I said, Commissioner Malcolm reported that they do believe we're starting to see a little bit dip in our cases, which is great. The overall state's percent positivity dropped to 9%. That's a drop that they were hoping. And we saw the lowest case count in the past 3 weeks this past week. However, just like what we're experiencing here, and I'll dive in a little bit more deeper into this, hospitalizations are up, and we're at all-time highs for 2021 across the state. So now gave you the United States, where we are with Minnesota. So let's talk a little bit about Olmsted County. So the graphic on the left comes from the New York Times. This is actually my favorite graphic. I like to see data in different ways, just not in bar charts. And I was talking to the other epidemiologist that I work with, and he said this is his favorite graphic too. So both 2 epidemiologists approved graphic right there. But I think this is for people who, again, you can look at all this data in the graph on the right, but this graph really or the chart from the left from the New York Times, I think kind of helps kind of tell the story of where we're at. So you can see right around this time last year, we were experiencing those dark red boxes, and that's the exact same spot where we are now. It feels a little bit like Groundhog Day. I'll be a little bit honest, from right after Thanksgiving is where we really saw cases really take off. As I noted, with the 2 gray columns are our highest weekly case counts that we've seen. So unfortunately, 2 weeks ago, we hit our new weekly case record of 927 cases in Olmsted County. That has dropped to around 727. So, but again, I think a little bit of that is a little artificial due to the drop of testing over the holidays. But the important thing here is to say too is we saw these peaks like we did back in 2020. We're hoping though, with the advancement of having vaccine, with boosters, and continuing those messages, and then especially getting the availability of vaccine with our 5 to 11-year-olds is going to be really, really helpful for us to start to see that decline. Because what we are seeing right now is around this past week, around 35% of our cases were 18 and under. That's probably one of our highest weekly percentages that we've seen. I believe at one point last May, we were around 40%. Typically, we've been a little under 30% on a week-to-week average. So a big thing here is really to continue to promote that vaccine, especially now with those 5 to 11-year-olds. And I think Denise is going to be talking about how we're partnering with to get those kids vaccinated. A couple of other key trends that we're monitoring is our percent positivity continues to remain quite high. Last week, I think it was around 23% our percent positivity. This week, it dropped. So again, trying to look at some positives here to around 21%. Again, we did see from an official, like from Mayo and from OMC, we did see a drop of around between 300 to 400 tests from the previous week. So again, not to throw this week out completely, there's valuable things to learn, but I think we need to see what next week is going to bring to really better understand. One thing we do know for sure, though, is hospitalizations are increasing. Here in Olmsted County, we're seeing some of our highest hospitalization rates that we have seen the entire pandemic. And that's usually what is expected when we're seeing this high case count. So hopefully we'll be able to start to see that decline in the next couple of weeks. But right now, I believe we have like 34 people who are just in non-ICU and around 7 people in ICU. The other thing what we're seeing with our hospitalizations too is we're seeing people in the hospital for a longer time period than what we have seen in previous. So I know we've had a couple of people get discharged who have been in the hospital for almost 3 months. So we're definitely seeing people in the hospital for longer stays as well. All right, so let's talk about vaccines, because this is another area that we should be celebrated and we should be very proud here in Olmsted County. So here's some statistics for you. So looking at Minnesota's total population, around 66 or almost 2/3 of our population, total population in Minnesota, have received a COVID vaccine. Here in Olmsted County, we're at 78. Minnesota overall passed the CDC 80% threshold for 18 plus this past week. So that was a pretty big milestone for the state. When we look at our 5 to 11-year-olds, Minnesota overall, of almost 25% of our 5 to 11-year-olds have received at least one dose of the COVID vaccine. That's huge. If I go back and again, looking at where our cases are coming from, where some of our most vulnerable population, that's a huge step for us of getting out of this current wave where we are. Olmsted County, we are at 36%. I wanted to say we are number 1 in the state, but that dang Cook County up in northern Minnesota is beating us to the punch again, just like they have in every other. But
we're number 1 for civilized counties.
Yeah. But in our defense, for them to get to 50%, they only had to vaccinate 147 kids. So just saying, it's just a little bit different. It's not an apples to orange comparison. But besides Cook County though, we are by far light years ahead where a lot of other counties are. Most counties right now are somewhere between 15 to 20%. So that's just a huge kudos to our citizens here in Olmsted County of getting their kids vaccinated, but then also our providers in our county too of getting shots in kids' arms. Another key statistic that we will be looking at, especially now with additional doses being offered to anyone 18 and over. So here in Olmsted County, we're around 35% of anyone who is eligible for an additional dose. So an additional dose, this is where we have to be careful with our language. An additional dose could be a booster or a third dose, or for those who, J&J, that would be their second. So that's all encompassing, and that's looking at those who are 18 and older. So we wanted to continue to monitor this too, especially because we know with the Omicron variant, but also for us to get out of this Delta wave we're in, boosters are going to play a huge, huge role with that. So those are just a couple of key data statistics before I hand it over back to Denise. Any epi questions that you all may have? Yeah.
So you talked about Delta. Do we know what percentage of our citizens have Delta?
Right now, the state assumes that 99.5% of all cases in Minnesota are Delta.
That's interesting. So I find it curious then, because they say Delta in theory is more contagious but less deadly, but our hospitalizations are way high.
Our hospitalizations are higher, but we're not seeing all of those hospitalizations convert to deaths like what we were seeing back in 2020. So if we remember back in 2020 for December, here in Olmsted County, we were averaging a death a day from COVID. We haven't seen that, and we haven't seen that yet. I think in November, we've had around 10 deaths, which is 10 deaths too many to COVID, but we're not seeing that high death rate coming out of the hospitalizations.
What percentage are unvaccinated that they're still seeing?
Yeah, so right now our sample size is quite small in the grand scheme of things. I would say around 80 on average, between 75 to 70% of those in the hospital are unvaccinated. I think it's also important to call out too. Dr. Fauci has also talked about too of when we start to talk about hospitalizations and vaccinations, we also need to start to say were they boosted or not, or had they had that additional dose, because that's a really important factor with that. And unfortunately, right now, we don't have that data to be able to get that granular with our hospital census.
Do we know what's happening in terms of hospital beds and availability of hospital care in our county?
Yeah, so what I can speak to is what we know of Olmsted County residents. I do know, talking to our healthcare partners, and I don't want to put words in their mouth, I know our systems are stressed, and they have been for months now. And so when we also start to see a good indication of that stress level is when we start to know or see more Olmsted County residents hospitalized. That usually means that there's more, the hospital census overall is growing too.
On a call that for the State Health Advisory Council recently, the commissioner had announced about these 2 teams coming out of National Guard.
Mm-hmm.
And she said that they had actually applied for 4 different hospitals in Minnesota. But there was only 2 teams available at the federal level to come in. And I don't really remember what phrase she used, but basically it was, that is sort of the last line of defense when you're calling in the National Guard.
Yeah.
And if we don't have the National Guard available because they're fully deployed, it's another red flag of high risk for our population.
Yes.
So.
And so actually, before joining for the county board, we meet with our hospital partners 2 to 3 times a week to get a better understanding, but then also to get a good understanding too with our long-term care and their facility needs too. So all of this is still, while we have scaled back our efforts, we're still, those partnerships are so essential for us to understand what's really going on and how we can best be partnering too. All right.
Thank you, Megan.
Yeah, no problem. Turn it back over to Denise.
All right. Hats off to Megan and her team. I can't thank them enough or highlight enough how important the work they have been doing through the course of this. Helps us keep informed. So I'm going to talk briefly about just what are our current efforts. And Megan alluded to some of those. Obviously, a big part of those right now are vaccine clinics, right? And so when we say vaccine clinics, I think it's important for the board to know we do still do during just regular clinic hours at Public Health have opportunities for people to come in to get their first dose, right? We're trying to still be available for people to meet them where they're at in their decision making. So with that said, we also still do second dose as well. We have had a lot of attention recently on the booster clinics, as Megan said, the importance of just the waning of the vaccine. And so we have held multiple booster clinics. Our last one, I think, was just under 300 individuals, so we're still continuing to go strong there and encouraging individuals to continue with those booster clinics. So we do those on site, and then I think it's also important to know we also are, and part of this is through the partnerships that Megan discussed. In our meetings each week with our healthcare providers, we really have, I think, done a wonderful job of looking at divide and conquer based on who has resources, whether that's staffing, number of vaccines we have on hand, et cetera. So we've also we have taken the role of going on site to some of our food manufacturing, our food processing manufacturing, and other high-risk sites to be able to offer the booster on site in places where we saw significant outbreaks over the last 2 years. So a lot of work being done there. We also are, as Megan said, the 5 to 11-year-olds has been a big focus lately. And so we were a little, I don't want to say slower, it was intentional. Again, with those meeting with healthcare partners and the data that we had received, a good portion of parents had told us they would prefer to get their vaccine in the healthcare setting with their medical provider, just because of the sensitivity to a 5 to 11-year-old receiving the vaccine. So we then said that we would take on the role of reaching out to our schools, other high-risk areas within the community, working with our community connector model, doing outreach and recruitment there with different cultural citizens here, and providing different clinics there. So with our 5 to 11, we held our first at Public Health yesterday. That was successful. With that clinic, we did a lot of recruitment for our clients who are high risk, those children, Boys and Girls Club, and other youth serving organizations as well. And then we did end up being able to post it broadly to fill any of those additional slots. So that's going really well. We also, as I said, are working really closely with the school districts. So just because a good majority of parents are wanting to do it through the healthcare provider, we want to fill those gaps. So we've worked with the school districts and asked them to distribute a survey so we could figure out interest, again, based on resource to make sure that we were hitting the needs. And so we have clinics coming up on site for 5 to 11-year-olds after school hours, again, to make it convenient for families to get there. We are already scheduled with Byron, Dover Yoda, Stewartville. We were on site at the Alternative Learning Center here in town. And we are continuing to work with Rochester Public Schools to figure out what the best approach is there. So those will be ongoing as well. So really, we're still covering the gamut of all ages, set first dose, second dose, boosters, like Megan said, third shot, whatever it is where the need is. So really proud of our staff and of that collaboration that we have going on here. In addition to that, I think it's important to know, and I briefly mentioned this already, we do continue to really work hard with our partners and community connectors, working with the Diversity Council, Rochester Healthy Community Partnership. We didn't facilitate these clinics, but we helped coordinate and advocate and promote for on-site clinics at Gage, Riverside, and Longfellow. Mayo took the lead on that one. Again, we just helped with connecting people and getting people registered there as well. So we continue those efforts, continue to do town halls, forums, whatever is needed to continue to get the word out. So the communication, I think, is the other big piece. Our JIC, our Joint Information Center, still is up and running and strong. So that's with our healthcare providers, Rochester School District, et cetera, so that we're having joint communications with press releases, trying to work really hard in coordinating and getting the information out about when clinics are, where they're at, how people can access them, et cetera. So very proud of those efforts as well. And then lastly, I think it's important to know that we do still have staff who are taking calls daily, just helping people navigate protocols, best practice, how do I access things? We think we have an outbreak, right? So continuing to be that link to resources for them as the best as we can. And lastly, I can't not thank Megan and her team enough, because we do continue with the surveillance, and it gives us the best picture of where we're at in our community to help us make informed strategy decisions around what we need to do. So any questions or comments?
Thank you.
A lot of information.
Yeah, Madam Chair?
Oh, yes.
Yeah. Hi. Denise, thank you very much. We all hear from people that talk to us about COVID fatigue. And the question is, when is this going to be over? So from the public health perspective, what's the fastest way to end a pandemic?
Human behavior. No, I mean, that's the $1 million question, right?
Yeah.
I mean, when you have change in variants, et cetera, we do feel like we're chasing our tails sometimes. We're really proud of where we've gotten, but I really can't emphasize enough vaccines. We can see in the data they're working, and we respect the personal choice. We do, but we are seeing that it is they're
It
working.
is a personal choice, but I think what you're saying is the fastest way to get over a pandemic is for people to get vaccinated, and then it won't have any place to go, and then it dies.
Well, to be honest with you, we think this is probably something, Commissioner Wright, that we're going to be living with forever. We just need to get it to a point of endemic phase, right, where we're not having and seeing the deaths that we're seeing across the world or across the nation, still within our state. And vaccines will still be a big part of that.
Well, there's a new word, endemic. Thank you very much.
You're welcome. Any other questions?
Thank you for putting all that effort into getting people vaccinated and opportunities for them to do that.
Yes.
Yeah. That's wonderful.
thank you guys for your time and your support. And I mean, hats off. We have amazing staff. We have amazing employees in Olmsted County. So
Do you have COVID fatigue?
I plead the fifth. We're passionate. We're still going strong. But we would be lying if we said we weren't fatigued too.
No.
Thank you.
Thank you.
Thank you.
Yes, Heidi.
Madam Chair, your next item, recess for closed session, is in room 4.
Mm-hmm.
So I just wanted to let you know it's ready to go in room 4.
So we are going to recess, but not adjourn our meeting, and then do board and committee reports. We'll start with Commissioner Brown.
Not much. Had Ready, which always interesting, but not a great deal of information. Just kind of status and strategy and plans. And Mark and I had a joint powers board, which has been quite some time, Lake Zumbro, and it appears, I'm sure, say this, there won't be another one. I'm sure there will be at some point in the future that something will come up. But the dike breach and everything is kind of closed. We've paid the vendors. We've put a notch in all the boxes, and we're thrilled. So the Joint Powers Board that I've been on since 2009. We had very few meetings.
You're going to miss it. Okay.
Which joint powers board?
Oh, I'm sorry. Lake Improvement District.
Okay, well, there's more than one.
Everybody
I know there's only one close to your heart, but
closest. So that's what I have. So it was good. And Mark can add.
I don't have anything to add, but yeah, a successful project, and that's pretty much it. Our review.
Very successful.
Awesome. Matt?
No, actually, I don't have anything. Thanksgiving. Nice to see you.
Yeah, right. Not much else happening.
well, I have the report from 15 different committees.
And last
Motion to
Commissioner
adjourn.
Wright, Commissioner Wright said he'd cede his time to me, and so could we just have glasses of water delivered, or maybe hot coffee while I report out. I actually just wanted to call out the Grand Park Committee met, and we started looking at the parameters for the contract with Ready to work on the Seneca site.
Yep.
The probably out of the Health, Housing, and Human Services Committee that a couple of us were at yesterday, call out that we heard that mental health commitments have gone up very significantly in the last year, and that poses a potential for increased cost to us because the state hospital discharges when it's no longer medically necessary, or if they have to stay there, we pay 100% of the cost. And that the state hospital is, as I said earlier, is not taking as many patients because they have a severe staffing shortage. And so I think those were probably the most significant things of that committee's meeting this week. A couple of us are going up to AMC to finish up the platform work there, and that's my report.
Okay, Commissioner Wright?
I sent my stuff out by email on all the legislative stuff, so if you choose to comment on those things, I'll take that to AMC.
Okay.
Okay.
And that, I yielded my time to.
I'm surprised, Commissioner Cascade didn't talk about the announcement from. Thought you would.
Oh,
do
this
that.
one. Oh, I'm happy to if you want me to.
Sure, because you put the time into that coalition.
So the Coalition for Housing had a press conference this morning, and it was announced that Mayo is contributing $5 million to the coalition fund. We met at Maywood Acres, and it was announced there that a current shed is going to be converted into housing for homeless veterans with support from MACV, which is an association that works with veterans' needs. The MACV was represented there as well, and it appeared that we got some very good press coverage about the coalition, about our future of working on access to home ownership, preserving affordable rental housing, and housing innovation as the three broad areas of the coalition's intentions as we move forward to make concrete the plans. I also understand that the city is going to look at their ARPA funding next Monday, and we are anticipating that they will make some allocation to the coalition. And in Councilman Keen's remarks, he noted that they've calculated in the last several years the city has spent $9 million toward housing, and that they anticipate they will continue to do that in a variety of ways, not all direct cash as the coalition as we're doing, but they're anticipating to do that as well. And it was announced that the $4 million that has been allocated by the coalition has had $120 million worth of economic impact, or has motivated $120 million of investment. So it's anticipated we can do something similar with the 10 million from us, the 4 billion, was it 4 million from Mayo? 5 million from Mayo, and hopefully a million or so from the city. It's hoped that we will be able to really do a lot more around that affordable housing for particularly kind of workforce affordable housing focus. So.
Yep.
Thank you for that. Entertain a motion to adjourn.
So moved.
Okay.
What, Matt, did I do something wrong?
No, just
Oh.
scratching my head.
Oh, okay. I can't believe I've gone through a whole meeting without making a mistake. I'm waiting for it. Okay. Yeah.
So close.
So close. Okay, we are adjourned, and we'll meet back here at.
No, we have to vote on it.
Oh. I knew it. We'll start with Mr. Roman Catalan.
Well, good evening, everybody. My name is Wilfredo Roman Catala. I'm the Olmsted County Chief Financial Officer. As you know, this is a public meeting. The purpose of the meeting is to share with you the 2022 Olmsted County budget and levy needs. We're going to cover a few things high level. The purpose of property taxes, how they impact your property taxes in general, high level conversations. And I know Mark Krupski and staff from the Property Records and Licensing are here to address any very specific needs that you have or questions regarding your particular property tax. So make sure there's a sign-up sheet that I believe Lisa has one already started. Also, if you would like to address the board, once I'm done with my presentation, please put an X in the list, so then we can call your name and you can come forward. Okay, with that said, let's get it started. So, there's a number of entities that play a role in your property tax. Obviously, the state legislature is one. They establish the property classes, the class rates, the level of state aid that they're going to provide to the local governments. They set the amount of homestead credit. That's a very specific aid to you individually, and the homestead credit exclusion. And many times what will happen when property taxes go up is, in some instances, your property valuation has gone up, and then the homestead credit has reduced to a number that is not that beneficial to you anymore. And that's one of those things that probably is good to talk to our property records and licensing staff so they can talk those specific things with you. Also, local governments, just like Olmsted County, the city of Rochester, townships, we provide a significant number of services to our residents. And depending on the need and the cost associated with that, we also influence, obviously, your property taxes, because those get distributed accordingly based on property valuations. And the county assessor. And the reason the county assessor is to assign each property market value and property classification as provided by statute. That is their role. And obviously, at the end, the result of your taxes is a combination of those different entities' decisions. What factors affect your property taxes? Well, there's several items that affect your property taxes. Our property taxes. I'm also a resident, so I'm not excluded from those. But the few that I'm going to list here are the ones that have the largest impact on your property. Obviously, the change in market value. And I'll address that a little bit further as well in my presentation about changing market values, especially in the city of Rochester, but all over the county, we've seen property values increase. And that's especially in the residential side, very what we call the hot market. There's a lot of, I don't know how many of you, when you go and trying to find a new home, for example, and you go try to place a bid for that particular property, many times is the property start at X value, many times it's sold beyond that number. And that's years ago, you don't used to see that. Now it's fairly common that you have to bid higher in order to get the property that you really like. Obviously, changing the tax levies for the county, the cities, and township, like I mentioned before, have a role in how you impact your property taxes. New taxes approved by referendum. Sometimes the schools or the city may have specific need to address, and they ask for voter approval. Obviously, those will have an impact in your property taxes at the same time. And obviously, changes in how the state, the legislature, they do many mandates at the local level for counties. And many times those mandate comes not properly funded, and sometimes they're not evenly funded. So that also have an impact because now we as a service provider to our local residents have to provide the service, but with an increased cost to locally, but at the state level not being provided, there's a significant funding to make it happen. Like I mentioned before, we have a very strong residential market. Cities within Olmsted County continue to experience that very strong residential upstick, if you will, basically prices going up. As you can see here, we have in the city of Stewartville, for example, the median sale price between a year ago and as of the end of year to date, the median is about $247,000 or 6.3% increase from a year ago. In Rochester, the median sales price is $290,000 or 12%. And in Byron, median sales price is about $335,000 or 24%. And in Orinoco, that median sales price goes up to $392,000, although in this case, it decreased from about 12.7% from what it was a year ago. So again, that's when I mentioned how the market influences the outcome of your property taxes, that's a big component of that as well. So here, what I would like to display is a very high picture of what the 2022 proposed county taxes are. Specifically for the county, it's about $112.8 million, an increase of $5.2 million or 4.9% from 2021. So the 2022 proposed county for the Housing Redevelopment Authority, what we call the HRA levy, will be $3.9 million, an increase of about $156,000 or 4.1% from the current levy of 2021. Also, it's important as a growing community, Olmsted County, we have the benefit of new construction. And also, though the new construction provides an opportunity for the expansion and distribution of property tax. So what we see in this graphical representation here is that new construction assessed this year in 2021, but payable next year in 2022, we see that it's about $293 million in total. That's the new stuff. We see that 60% of it is in the residential type of parcels, 15.6% in apartments, 22.9% in commercial, and 1.5% in agricultural. The benefit of all that new construction is that offsets the levy by about 1.25%. In this graph, what you represent here is the 2022 county property tax compared to estimated market values. So what we see here is that residential share of market value is 64% and pays about 55% of the county property tax. Apartments share about the market value of 7.4% and pays about 7.6% of the county property tax. The commercial properties share market value of 17.4% and pays about 30% of county property tax. And agricultural properties share market value is 10.9% and pays about 7.3% of the property taxes. I'm gonna wait there for just a second. You can contemplate that for a second and then I'll keep moving forward. So in the next few slides here, what I will try to convey to you is the impact the county and their HRA levies will have into residential parcels. I am going to just focus my attention on residential parcels because just like I just explained, those parcels share about 64% of the market value and pays about 55% of the county property tax. So not that I don't want to go into details about the other property type of parcels, but I would like to focus on this group, especially I assume that most of you, that's what you're here for, rather than the other type of properties. So in this particular table, what you will see on the very top, the green highlighted section, these are all kind of estimated taxable market values ranges. So in what I will use in is median amounts. Median is basically what is the midpoint of something. So what you will see here in the first highlighted in red is that residential parcels with an estimated market value between 150,000 but less than 200,000. And what you can see is for that group, the median for that average above is about 175,000. That's the median between those numbers. And the county levy, the median yearly county levy is about $828. The HRA median levy is about 30, and the median for all local levies combined, so township, school district, city, depending on where you are, is about 2,486. Obviously, this is the median point. If you're in that range, for example, there'll be half of the people will be below that, and other half will be higher than that. But that's just the midpoint. Just trying to convey that that's the point of reference. I'm going to jump 2 columns to the right here, and you see that for residential parcels with an estimated market value between 250,000 but less than 300,000, which is about, for that group of parcels, the median is about 272,000. The median yearly county levy is 1,288. Again, that's the midpoint for the county alone. For the HRA, the median is about 46. And if you consider all the local levies for that particular property group, it's about 3,781. And then finally, I'm going to go to the 4th column here. So you can see that group is the residential parcels with estimated taxable market value between 300,000 but less than 400,000. So the median for that group is about 340,000. And then the median levy for county, the median for county levy is about 1,613. The HRA median is about $58, and the median for all local levies combined is about 4,656. Again, I'm going to stop here for a second so you can appreciate that before I move forward. Okay, so now I have this other graphic, and again, these all are residential parcels. So this graph is showing us the median county and HRA tax combined by year for those residential parcels. And to the very far right, what we see is that the median county and HRA tax change, so between 2021 and 2022, for example, that very last column, the median change in tax for those residential parcels in 2022 was $67. Obviously, to the left of that is the history of changes between year to year, represented again by medians by year. Obviously, in 2021, that number was a negative number as a median. And before that, you have different values as well. Again, each individual parcel will have a number that will be greater or lower than that as it changes, but that's just the midpoint. So this other graph here, it shows the impact of the 2022 property county and HRA levies combined. And about 5% of the residential parcels will experience a reduction from the county and HRA taxes. So a very small amount of parcels will see, for whatever reason, the numbers are going to shift in the other direction. For most of us, that's not the case. So about 33% of residential parcels will experience a property tax increase up to $49 or less than $50. About 49% of the residential parcels will experience a property tax increase between $50 and $149. Again, those are the numbers. And about 8% of the residential parcels will experience a property tax increase between $150 and $249. And finally, here we have about 3% of residential parcels will experience a property tax increase between $250 and $499. So that gives you kind of an idea where the different numbers are falling in the process. Again, I'll stop here. Let's see if we can make that a little bit larger. So probably you can appreciate that a little bit better. And again, I'm going to stop here for a second and before I continue. Okay. So obviously, you know, the majority of services that we provide, we're a service-oriented organization. So many of the services that we provide are focused on people, but also there's a number of different things that they will do that I'll highlight here in a second. But I think the important component is that unless we are talking about an enterprise fund like the Waste to Energy facility, most of our services, some way, in some shape or form, are funded by levy. Some a little bit more than others, but at least some of them, most of them will have some levy implications. And for example, public health, you know, we provide population-based health, disease surveillance, especially now during COVID and this pandemic. At least I can appreciate having the type of public health department that we have. Also, the county is hired by the state to do a very large number of services, to administer medical, financial assistance, provide children protective services, adult protective services, vulnerable adult services, very important housing. You've seen all the work that has been happening around housing and helping individuals have a place to be. Very important, law enforcement. You know, I don't know about you, I like to feel safe in our community. Patrol, investigation, our detention center, the jail for those adult offenders. And especially now in the upcoming wonderful season of Christmas and winter, maintaining roadways clear during snow periods. I don't know about you, but if we don't have this collaborative process where we all pitch in, so we have roadways clear so we can go from point A to point B, I don't know how we make it work. So another very important service that we provide to residents. And like I said, there's an endless number of very important services we provide. That's just a flavor of those. Now, let's go through the actual budget. And what you will see here is my attempt to share with you and trying to be transparent in a way that we have an enterprise fund, we have governmental funds, we have an HRA, a Housing Redevelopment Authority. I'm trying to put many of those numbers together and show it to you in a way that is simple, yet you can see the magnitude of what the numbers are. And yes, these are large, very significant numbers, but to maintain and operate an organization that works on your behalf and provide, in my opinion, a very high level of service and very high level of excellent service, it requires to be properly funded. So this is kind of this first graph that you see here. Again, governmental funds, enterprise funds, and HRA combined, about 282.5 million. That's kind of the big total there. And like I said, as a service provider organization, our biggest asset is our workforce. And they also represent the largest cost. Salaries and benefits represent about 126.4 million, or about almost 45% of our budget for 2022. Um, Keep in mind that we have a workforce of about 1,283 full-time equivalents. Capital expenses is our second largest cost of 35.8 million or 12.7%. So again, I mentioned highways and roadways. So road and bridges construction and preservation, along with equipment necessary to maintain those roads, represent a significant part of that capital cost. But it's also a very critical component of our economy. So we just need to invest in, well, we need to put the dollars into it so we can function properly. Service and charges is our third largest cost at 34.3 million or 12%. Olmsted County have many relationship with other governments within the area. Obviously, we do a lot of collaborative work. And one of them is, for example, the Dutch Fillmore and Olmsted Community Correction, which is included in these service and charges, how much we support that organization in order to provide the services for the residents of Olmsted County. Okay, and payments for clients is our fourth largest cost at 33.6 million or 11.8%. And when you think about payment for client, think about child placement, child foster care, helping people with mental health needs. Think about people that need help with rental assistance, all those different things. That's what you need to think when you see the word payment for client. It's not that we're handing money to these individuals. We're paying for services, for certain services on their behalf. And I believe as a community, we're better off because of that level of funding that we provide. And the other part of this is many of these services, even if we wish not to do, although that will be, I think, detrimental for us as a community, we are required to do it by the state. Many of these services, except for highway, cleaning the roads, that's not mandated. The other stuff we have to do. And I believe about 80% or close to that of the services that we provide is required by the state. I'm not going to go over in all the detail for all the other numbers. I just shared with you the highest figures. I'm just going to highlight that and put it in higher, so magnify so you can see it. If you could not see that before, like I said, I covered the first four highest amounts, and I'm going to leave it at that. Okay, so now we talk about the budget by category, these different expense categories. Now, how does it look like if we split it up by division within the county? So the Health, Housing, and Human Services Division is about 111.5 million, or about 40% of the cost of providing services in the county. Physical development is about 102.4 million, or 36%. Public safety, about 42 million, or 15%. And the general government, 26.8 million, or about 9%. So we talk about how do we spend the money in providing services to our residents. Now, where the money comes from, this is the next part. So the revenue side, again, combining that HRA, governmental funds, enterprise funds, and the HRA combined. Again, it's a balanced budget, so it's 282.5 million. The expense side and the revenue side go together. So the largest, obviously the largest property taxes represent the largest funding source at 116.7 million, like I mentioned at the beginning of the presentation. When you see all these things combined like that, it's about 41% of our revenue funding source. Intergovernmental funds, intergovernmental revenue are the funds that comes kind of in second place, about 71.4 million, or 25% of our budget. And when you think about intergovernmental, think about funding coming from the state level, from the federal level, and maybe other local agencies who we're working with, and they're providing that type of funding to the county. A significant portion of the support services provided by Health, Housing, and Human Services Division is funded through intergovernmental revenue. Again, the state requires Department of Human Services, Department of Health, you name it, require certain things for us to do, and they provide, to some extent, funding for us to provide those services. Charging for services is the third largest funding source at 51.4 million or 18%. And again, because I'm trying to mix the enterprise funds here as well, more than half of what you see of that number is to support our resource recovery plant, the landfill and recycling services. That's why that fee for services number is significantly larger. And this is one of those things where, because it's an enterprise fund, we believe that the amount that is charged is based on the level of services that you receive. That's why it fits really well with the fee for services in the enterprise fund. And transportation taxes, sales tax, specifically devoted to transportation, as well as what we call the wheelage tax, those $10 that you pay for your taps when you renew those. So those two combined is our fourth largest funding source at 16.7 million or 6%. And like I said, this is a really, really critical funding source for that road and bridge construction and preservation work that I mentioned before. Okay, so this graph here shows the distribution of property tax levy by division. And as you can see, health, housing, and human services consumes about 42.4 million or 36% of the levy. Physical development, 19.9 million or 17%. Public safety, 35.1 million or 30%. And general government, 19.4 million or 17%. This second graph to the right shows the distribution of other funding sources by those divisions. So the health, housing, and human services is 69.2, or about 42%. Physical development, 82.5 million or 50%. Public safety, 6.7 million or 4%. And general government, 7.4 million or about 4%. Okay. So basically here, that's the conclusion of the presentation. A few things I'm going to mention for the 2022 levy and budget will be adopted. Our regular board meeting that begins at 9 a.m. on Tuesday, December 14th, right here at this same room. And I have some notes here about if you have specific questions, who to contact, and that this presentation will be available on our county website if you would like to go back and refer to it. Now, please, if you would like to speak, I know some of you signed the list and put an X that you were interested in addressing the board, making sure that you use the microphone here at the lectern. Please state your name, address for the record before speaking, and just give me about a minute or two so I can put everything back in place so you can then address the board. Thank you.
Thank you, Wilfredo. Do we need an announcement about anyone who may be here to talk about their assessment rather than their taxes?
Thank you.
Want me to make that announcement? All right. So some people may be here tonight because they would like to have a discussion with us about how their property was assessed, which is a different topic from your property taxes. So we have staff here available, ready for you. If you want to do that, rather than stay for the talk about property taxes, if you'd like to see someone about your assessment, Mr. Mark Krupski is here, and his staff will talk to you and you don't have to stay here for the rest of this. So is there anyone here who wants to talk about their assessments? Please see Mr. Krupski. Was there anything I forgot to say, Mr. Krupski? Sure.
Good evening, Chair Miss Stephanie Podolsky, Mark Krupke, Director of Property Records and Licensing. If you're here to talk about your valuation, the value of your property, if you think it's incorrect, come and see us out in the foyer. Thank you.
Yes. All right.
You have the list.
I have the list.
You
Yes.
have the list and the folks with the X next to their name
Yes.
would like to speak.
Yes. So I will call you up by your name, but because this is recorded tonight, please come up to the stand, state your name, and state your address, and we'd like you to. Hopefully, you can say what you want to say in about 3 minutes. You can usually cover a lot of information in that time. So that's what we'd like for you to do. So the first person on our list is Wayne. And you may take off your mask so we can hear you better.
Good evening, commissioners. Good to see you again this evening. Wayne Ganaway from the History Center of Olmsted County. I'm the executive director, and I'm joined by my board president, Christine Rule, here. And really, I just wanted to come here tonight to express our gratitude for the county commissioner's work and the county's support in the past and currently for the History Center. We acknowledge the many priorities that the county has, and we value all of those priorities and the work that the civil servants and the professional staff do. And we also will be continuing, and we're proud to be continuing our telling the stories of this ever-evolving history of our county. The history is continuing. It hasn't stopped. It won't stop. And that's the thing about history. And we invite you all to come out to the History Center, and I guarantee you there's a few stories that you haven't heard yet, whether in our exhibits or in our archives. And I'm pretty excited because this weekend we're going to be hosting up to 50 soldiers from the local medical reserve unit, and we're proud to do that. Next year we're going to become a Blue Star Museum, which offers free admission to active duty soldiers and National Guards and reservists as well. So we're pretty excited about that. And that's all I wanted to say. Once again, I wanted to express our gratitude.
Thank you.
Do you have any questions?
Except I see you have a historic tie on.
I do.
Yes.
That's what I'm all about. 24/7. Thank you.
Thank you. Our next person is James Anklin. So please state your name and address for us.
Good evening. It's Jim Anklin in 4417 14th Avenue Northwest. I want to thank the commissioners here for inviting us in to speak. I own a rare and unusual property here in town. It is what is called an affordable housing unit. It's a fourplex. My rents are well below average. It's a nice place. I watch our elected officials and the press and sometimes online wringing their hands continually about finding affordable housing, and I'm providing that, and then in comes a 34% tax increase for me. So in college freshman psychology, we learned this is called cognitive dissonance. What we say and what we do are two different things here. I've worked in private industry my entire career, and at budget time, the vice president comes around and says your cost down target for the year is 1.5%. Cost down. Try to do more with less. It's a difference between the drive in a competitive marketplace versus a public entity. We need to adopt some of that mentality, that how do we do more without spending more. Particularly irksome, I also see the HRA special assessment, which began a couple of years ago. It's taking money out of my pocket and paying someone else to do what I do, providing low-cost housing. So I'd like to see effort made here to control these tax increases, because they're never going to go away. I mean, there's never going to come a year where my taxes go down. And year by year, creep by creep, it just continues upward. And it reaches a point where it's unsustainable. So that's my 2 cents. Out of my top 3 expenses, which are mortgage, taxes, utilities, 2 of those 3 are controlled by our public entities here in town. True. So I ask your consideration here, and every expenditure you make, you need to do what we do in private industry. Is it necessary? How will it be measured? And what return will we get from it? Thank you.
Thank you.
Thank you, Mr. Anklin. Our next speaker is Jeff Derby.
Thank you. Thank you, everyone, for having this meeting and having me up to the podium. My name is Jeff Derby, and I own my house at 801 4th Avenue Northwest in Rochester. And my question is, has there been some talk or consideration about the method used to determine the tax amount? It's been off a percentage of the value of the home for a long time. But the reason I bring it up is because the home value prices, unprecedented increases over the short period of time leading up till now and in the foreseeable future will outpace the expenses, because the expenses are partly due to like roads, right? The square footage of the roads relatively are constant. They're not going to change much. The size of Olmsted County won't change. And so if the value continues to go up on the home prices, then the income will go up. But expenses, yeah, there'll be inflation, so there'll be some increase in costs. But generally speaking, this methodology could lean in the favor of a surplus in income down the down the road. Because to give you one example, in the last 116 years, the value of the home has doubled in the last 116 years. But in the last 6, it doubled again. So if the percentage of the valuation is off it's exponential, so it's has to be a correction at some point. And I appreciate your time. Thank you.
Thank you, Mr. Derby. Steve Braun?
Good evening.
Hello.
Stephen Braun, 1985 Waterford Place, Southwest. When I received my valuation report that showed an 11% increase in the assessed value of my house, I was not concerned because I expected quite reasonably that the levy would be adjusted so that there would not be a windfall in taxes to the different taxing authorities. When I got this proposed tax report, I found I was wrong. The taxes that are going to be assessed by the county actually went up a shade over 12%. The taxes going to the city actually went up a little over 16%, which doesn't make any sense to me at all. Not even after hearing the detailed and report from your colleague. I want to know, how could this happen and how can I get it corrected? Because it is an unwarranted increase in the taxes. Didn't argue with the valuation report, but every place that I've ever lived across the country, when there's been an increase in valuations, which has happened over the past 40 years from time to time, the taxing authorities have adjusted the levies so there is not a windfall in taxes collected. However you adjusted the levies this go around, it didn't work with my property. And I want to know why and how I can get it corrected. So who do I talk to?
Property records and licensing, if you've got a problem with the evaluation, which then drives your property.
Sorry, say again, I'm hard of hearing.
Property records and licensing. Mark Krupski, who is in the room, right? The market valuation, if you have a problem with that, which then does in turn drive your taxes, if you have a problem with the evaluation or don't agree with it, that's the place to start with.
Oh, I understand that. I wasn't concerned because I expected the levy would be adjusted so that the actual increase in tax didn't match, or in my case, exceed the increase in valuation.
I'll be happy to talk to you after the meeting. I'll be happy to talk to you after the meeting.
You'd be happy to what?
To talk to you after the meeting. I'll stick around.
Dean?
Mark Tyne, yeah, I'll talk to you.
Fine.
Yeah, I'll talk to you
Yes,
later.
please, sir.
Sure, I'll talk
I'll
to
be
you too.
here.
I'll hang around.
Thank you, Mr. Derby, or excuse me, Mr. Braun. That is the number of people I have on my list who asked to speak. And is there anything else we need to do tonight?
I'll see if anybody else wants to.
Is there anyone else who would like to speak to us? Yes, please. Tell us your name and address and.
Microphone
The big one.
Big one.
Hi, my name's Sandy Monty. My family owns property across from St. Mary's Hospital, and I don't know if we're dealing with commercial and residential assessments, but we
Could
just
you give
cannot.
us your
The address? My address, 508 16th Street Northwest.
Thanks.
But my family's had this property for years and years, and it keeps going up every year. The assessments. We have 4 buildings. We pay over $30,000 in property taxes. And when I get traveling nurses and students going to Mayo for studying, they can't afford it. And I've been here before, to give you information about it. They can't afford it. I just had a traveling nurse call me tonight, and he says, "Can you give me a better deal on housing?" And I'm like, I can't even make our property taxes. We were late, and we were penalized because we were slow in making the property taxes. And the family members have had to pitch in to pay for it. It's ridiculous. I mean, and I really don't know what the answer is. I don't know how you assess the property, if it's strictly on location or I'm trying to understand how everyone here figures out what you charge for property taxes in the commercial, aspect of it. But it's just, they're literally going to be taxing us out of there. I mean, we are strongly thinking about selling the property because we can't make it. But the next person that comes in that wants to buy our property, I mean, they have to consider what they can build on 2nd Street. That's where my family's business is. What they're allowed to build, how high up they can build, and what's their property taxes going to be, and can they make a profit? So that in turn also for, residential property taxes is outrageous, I think. Because I look around at some of the streets, I don't see anything that's done spectacular. I know Broadway is amazingly, perfect. They've done a great job, but there's a lot of roads I see around town. They look terrible. The stop signs are terrible looking. The parks don't look all that great. I don't know where the money's going, really. I don't understand it, let's put it that way. Who determines what money goes where? Maybe I need to be more informed about it. But maybe someone here could explain it like exactly, in detail, how you determine that as far as commercial property taxes and, the location of it and why it's that high. And so that's all I got to say. I mean, I've been here before and I've explained in the past about my family's property taxes that keep going up. So that's all I got to say. But thank you, though.
Thank you.
Thank you for talking to us.
Madam Chair, perhaps she would like to speak with Mr. Krupski so she gets the basics.
On commercial property.
Mr. Krupski.
Commercial property.
Great.
He'll meet with you outside or.
Well, actually, hi, Mark Krupski, Director of Property Records and Licensing. I think I have just a couple of high-level statements that might help, and then we can certainly talk individually. Regarding Mr. Braun's concerns, and I'm going to talk a little loud, so it's helpful to you, so I'm not yelling. So over the last 5 years, the strongest real estate market has been residential property. And so it's increasing at a faster rate than other property types. So, and this is happening nationwide. Just for the last year, 17.58% increase in residential property. And this has been happening quite a bit. Last year we saw 7 to 8% increases in values. And there's really, I don't know where this will level off, because it's sustained itself for quite a while now. So what that does is one property type is increasing faster than the other. There's a tax shift that goes on that'll shift some of that taxes from the other properties to the residential. And we saw this happen in 2009. We had 50% increases on agricultural properties, and those taxes shifted over to ag. Then we saw when DMC, the advent of that, there were a lot of jockeying for property downtown, and that was the only game in town then. So then there was a large shift to those properties, and it made it difficult. So that's what's happening with our residential property. It's not just our budgets. Our budgets may be collectively going up about 5%, but because of the increased values, it's not affecting some properties as much as the other. And it's an ad valorem tax system. It doesn't take into account the ability to pay. However, our state has a very robust property tax refund program that people can apply for, and that can take offset some of this increase to people. So these are things that are available. And in reference to the commercial property across in St. Mary's, I'm not intimately familiar with your property, but I think it's a low-level property, and you're surrounded by a lot of high-rise property, and down along that stretch there. And what's happening is you're in a very desirable real estate market, and the land value is probably exceeding even the value of your building there, because you don't have. You look at like New York City, you see these big high rises, and I'm not saying this is going to make you feel good or anything, because as the properties increase, there's probably a high rise would probably be interested in that lot or assembling some lots to build something that'd be a higher utility of that property. So it makes it difficult for a smaller business, a 1 or 2 story business, to kind of survive in that because of the economics of it. It's just, that's what happens over time. So again, it's not maybe a great answer to as far as your situation, but that's what happens with the values. And I'm certainly welcome any specific questions. We can go out in the rotunda to talk about individual properties. So of course, if there are any questions,
Mark,
I'd be happy.
if you could just briefly, there were two gentlemen that came up, talked about that we'd get a windfall because of the market valuation increase. Could you go there a little bit? I mean, we set a dollar amount budget.
Well, yeah, there's no windfall. There's no windfall in local government. What happens is it's basically you have a mix of properties that are taxable. They all have different types of class rates based on whether it's agricultural, commercial, apartment, whatever. And whatever that comes in at, and then whatever the budget is, that's where it goes. If we get more value, then it spreads it out a little differently. As Wilfredo showed, we had quite a bit of new construction, but we have such a high value county. We're valued at over 21 billion. So with 300 to 400 million of new construction, it doesn't move the needle a lot to offset those increased costs, but it did do some. We saw an offset because of new construction of 1.4%, so that did help, but there's no windfall. We've heard that story even from vendors selling us software that you can pick up more value, and there's no windfall. The way the system's designed, it's not built for that. So
See, let me relate for your question specifically. All right, let me try to help clarify. We set a dollar value. All right, look at a budget, look at our needs, what we have to pay the state, what we're mandated to provide, and that dollar value is then divided by all the parcels, every single parcel, every category within the entire county. So if you're in one category that has seen a dramatic increase in market valuation, i.e. residential, you will see more of that burden shifted to your property. Other people that are in a different category may actually get a decrease in their property taxes. It's just the way the number spreads. We just set a dollar value. We don't get any windfall. We set a dollar value, and then we spread that amongst every single parcel, which we have about 64,000 parcels.
70,000, but yes.
70,000 parcels in Olmsted County. But depending on what happened to your particular classification, residential and property, you're in the same position. Mine went up a lot. The valuation on the property went up a lot. Okay, that's great. I'm not going to sell it right now, but it's good and bad.
And I think that's a common misunderstanding. You'll get a chance to talk just a second. Is people have the perception that they're taxed at a percentage of their home's value, 1% or 1.8%. It doesn't work that way. As Commissioner Brown says, we set a levy up for a dollar amount, and then that's shared based on your valuation as compared to others to pay your share of that dollar amount. So as home values double, the levy doesn't double. The levy is determined by the board based on what our expenditures are and what we need to cover our expenses.
There's probably one more factor I'd like to add. We have a benefit for homesteading property, okay? And a $76,000 home would receive a homestead exclusion of $30,400. So that's pretty good. You take 76,000, divide 30,400, and what's that give you, like 45,600. So that's great, but as soon as every dollar above that 76,000, that benefit decreases, and it zeroes out at 413,800. So a community like Rochester, where our average sale price is about 327,000, the benefit of the homestead has been greatly diminished over the years, and I think it might be an opportunity for the legislature to look at that and say, well, is that number outdated? It might work in maybe a rural part of the county a state that values aren't that high, but for a county like Olmsted County, the offset is very small for homestead.
Right.
So you have that, and then you also have that property tax refund, are your two kind of circuit breakers for residential property.
Thank you.
Question?
You done?
Yeah.
Okay, didn't want to interrupt you. I also want to talk about one of the slides from Mr. Roman Cantalan. We work very hard on our budget. We really pare it down. We don't hire everybody that every department wants to hire. We work hard on keeping that budget under control. The thing to understand is out of that huge budget, 85%, about 85% of that budget is mandated expenses. So as a county board, we only have about 15% of that budget that's discretionary for us to work on. And what we use that money for is programs that the state has not mandated. And most of those are programs for early childhood education, for for working on making children ready to get to school, to keep families whole, to pay for
roads.
plowing. We don't have to plow roads. There's a lot of things we don't have to do. And that's one of them that's not mandated by the state. But I think you would miss that a lot if we didn't plow county roads or upkeep them the way we do. So please keep in mind that the budget is not like a capricious thing. We've worked very, very hard on that budget. And remember that it's only about 15% of that budget that's discretionary for us to decide what to do with. The rest of it is mandated by the state for things we need to provide. They describe to us, we are an arm of the state, and the state describes to us the people that they would like us to serve. And they require us to serve those people, and oftentimes they do not mandate they do not fund the programs that they require us to provide. Those are unfunded mandates, and they're very frustrating for us. So I just wanted to add that to remember that from the presentation from our Chief Financial Officer. Thank you for listening to that. Anything else?
I think he wants to say one more thing.
Mr. Braun?
I am absolutely confident that you all have worked tirelessly and honestly on the overall budget. This is not my first rodeo. I have owned residential real estate in Des Moines, Kansas City, and here. My wife has owned property in West Virginia. So I've had to deal with, review budgeting issues in multiple jurisdictions. The overall budget is one aspect of what you need to look at to ensure equitable tax assessments. From my perspective, it is a windfall when my taxes, actual taxes, go up more than my assessed valuation, and I see no commensurate increase in the amount or quality of services. Every other jurisdiction in which I've owned residential real estate has taken a second step to adjust the levy so that there is not an increase in the tax bill equal to the increase in the assessed value. Am I making myself clear here?
Yeah, see, I don't know how other states run their system, but we're driven by state statute, state law. As Mr. Krupsky said, sales are what drive it. Previous year's sales drive.
I understand that. I'm not arguing about the
but
valuations.
that's what you're seeing, okay? And then when you look at the increase because of the category you're in, the size of the house or the category, as we said, it's a dollar amount that spreads evenly based upon evaluation. You happen to have a high evaluation, you bear a little more of the burden than a lot of other properties do. See, you're here you got hit with a high, and I understand that. I have the same situation in my house, but I can't change that because I know what the sales have been.
I understand that, believe me. I did not argue with my valuation. I understand how that works. But every other jurisdiction in which I've lived, they have taken the second step of adjusting the levy so that there is not either not an increase at all in taxes or not an uneven increase in taxes.
That may
not look at the levy.
The levy is what sets your taxes. So we set a levy this year of about $110 million. Okay, which is a 4.9% increase over the previous year.
My increase is way more than 4.9%.
I understand that. So conversely, if yours exceeded, well, actually yours didn't exceed, your valuation went up 11%, your taxes went up 12%. So that's less than 11 plus 4.9. So but for your increase was offset by somebody's decrease. Our levy amount collected is going to be approximately 110 million, what we set. I know you don't believe me, but I'll be happy to talk.
Oh,
to
I
you after.
believe you. I'm just not satisfied with the answer because there's a second step
Well, there's
that you
so
all
there
are
are
missing.
states out there like Florida that would set a maximum property tax increase on existing parcels. We're not to that point in Minnesota yet.
No, I'm not talking about that. The states that I lived in did not have that. The local taxing authorities took it on themselves to adjust the levy.
But the levy is set, and then your taxes are collected based on that levy. So if there's
I'm sorry, say again.
So we set the levy. So in the next meeting, we're going to set our levy, and what you show on your hand is what we anticipate that levy will cost you. So if we're going to adjust the levy, we would have to do it at our next meeting, and then your taxes could go down. But I don't anticipate we're going to do that because we've spent days working on this levy, balancing every.
Okay.
Sir,
I'll communicate with you.
I'll be happy
send
to.
you a copy of my
I understand. I'd like to
tax
enjoy the
bill
conversation.
and Mr.
Krebsky, he's out.
Your other colleagues.
Mr. Brown, I'd also like to point out that some of the states that you've lived in may not have the governance set up the way Minnesota does, where we are an arm of the state, and we have to administer and distribute state funds and programs, and so the other states you lived in may not have that form of governance, so it may not be a fair kind of comparison in the end.
Well, I understand
Okay.
that difference. And
All
there's
right.
a lot of differences that I don't even know about yet.
Right.
Sure.
Because I only moved back here last July. I was born here. I've got tons of family here. I was tired of flying back to Rochester to go to the Mayo Clinic. So it was a good move.
It's a good.
on our
It's a
part.
good
Thank
community.
you for listening.
Yeah,
to me.
Thank you, Mr. Brown.
I'll be in touch.
Okay. Yes, sir?
I'm Ray Hicks from 4709 Canterbury Court, Northwest. And I didn't intend to speak tonight, but listening to the stuff, you know, some of them is talking about the business property, somebody's looking at his individual house, and everything you guys say, I understand. It's logical, it makes sense. But what does not make a lot of sense to me, and where I think a lot of the problem comes in, is we're told, like, if we're in a certain property and that segment of the property, you know, jumps this way or that way, that explains why your bottom line tax number came out the way it did. And it does. But the hard thing is we are individuals, and we're all in different property situations. Somebody might be in a more valuable house thing and it shot up 25%, and I'm in a lesser one and maybe it didn't, or maybe mine went up 20% and they didn't. Year to year, people get stung. I was in one of those situations 3-4 years ago where my family got hurt really bad by the property taxes. It happens. Every year there's going to be people like this that are saying this. What really troubles me, you know, and this is a biggie, we're so used to property taxes for funding things. In the county, the city, the schools, they do need to budget, they do need to raise the revenue. I really hate the property tax as a main way of doing that, because people's ability to pay does not track the value of their property. It really doesn't. It can be way out of whack. And what happens is when your ability to pay, you can't make it, then you end up having to lose your property, downsize, give up your business. You essentially get taxed out of your home. You get taxed out of your business. And I personally, I see that as immoral. Now, I do understand that properties, the services needed to serve a property, there are some things that do track the property, and I wouldn't argue to eliminate it, but I don't think the bulk of the budget, and I'm not going to argue the fact that it's only 45% on that chart that comes from property taxes, but that segment that you want to raise from residents, really ought to be raised on their ability to pay, the viability of their business.
You know, I'm sorry to interrupt you, but I don't think we're unsympathetic to where you are, but let me again couch this is that man, Mr. Krupsey, who's out in the hall, is driven 100% by state law. Okay, and if he does not conform in terms of being within 95 to 105% of market valuation, which the state tracks, they will come in here and run this county in lieu of, and they will collect the taxes. So, right or wrong, you're talking about a state legislative problem of how they raise revenue, decide who gets hit, who can pay, and this is a pretty progressive state. And so there's a lot of leeway between here and here. And I'm not unsympathetic. Believe me, I agree with you. Okay, I'm not fighting you. I'm just telling you how the system works and how inflexible we are relative to that system because the guys up north are in charge.
The question I have is I don't know where the legal or where the law stands on whether you have to do it through property tax or not. Does the state tell you that's the only way you can raise it?
You bet.
So
there's only one way to do it.
We can't do income tax, and we're limited as far as sales tax. We do collect sales tax and a wheelie.
I feel strongly about it though, and I think if more people thought about it, they would too.
I'm not
you may
disagreeing
not
with
have
you.
the jurisdiction to change that.
I'm not
But
arguing
if
with
you
you,
get
believe
the blowback that's coming from your residents and your citizens,
will
and
find
you are
agreement.
sympathetic, you know, we would be on the same team to work at the state to change things rather than just accepting
Say
them.
one more thing and we can go, but you guys have a bigger voice up there than we do. They pay absolutely no attention to us. They think we're their self-interest, just trying to take care of the county, right, and take care of our budget. But I'm telling you, you guys have a far bigger voice. The public really does with your local legislator.
I've got to close.
And they still live here.
I've got to close because I've taken quite a bit of time.
It's all
but
right.
I just think we're set up for
Well, we do that a lot.
And
Thank
that's
you,
what
Mr. Dix.
happens in these meetings a lot, and it's going to keep happening.
I do want to say, Madam Chair, that we are in a situation right now where the Senate tax chair represents half of the city of Rochester. So Senator Nelson would be a place for the citizens to let them know, to share your views on the reliance on property taxes for local government. And the progressiveness and the point that Mr. Krupsky brought out about the homestead credit no longer matching our market. That's another thing that the Senate and House tax committees would have jurisdiction over. And to the earlier gentleman, there's only 11 states that have the state system that we have of state administered, locally delivered human services. And when you looked at our budget, the bulk of our money is going for health, housing, and human services. And we are mandated, we are required to meet state service levels. So again, we do our best to keep your taxes as low as we can and meet our legal requirements. And it's a complicated tax system that Minnesota has. So do appreciate you being here, but and I'm not trying to pass the buck, but we are in a unique position right now with having the Senate tax chair representing half of the city.
Thank you.
Half of the county.
One more thing. Last one.
You mentioned that some of the...
Come closer, please.
Yes. Jeff Derby, 801 4th Avenue Northwest. You'd mentioned that they kind of run the show in that government. So what would the best advice be, like the governor, like should we vote Republican?
They're equally guilty. In this regard, they are equally guilty.
Okay, but I do want to mention an appreciation about how our taxpayer dollars do benefit. So I ride my bike to work almost every day. I do work at Mayo Clinic, St. Mary's, and I live in the northern addition, so right across the street from Northrop. community education center. I ride my bike and I take the path that goes through Cook Park and Kutsky Park. And this summer there was a lot of trash, garbage that must come from the sewer system, and it runs to the river. And there's a grate there to prevent like kids who gonna go up in there. I just had sent a picture and an email to the forestry division, I think it was, and that same day, I'm not joking, that same day a crew went out and cleaned the whole gutter system. So it does work.
I know, it does.
And I also want to say one last thing. I appreciate too that I was informed tonight that when people apply for a homestead and they've purchased their home after December 1st, but before December 31st of that year, the cutoff was December 1st. I fell into that category, but I am really happy that it was changed to 31st because I was in my home for all of 2021, but I still had to pay.
Reading that one.
But so thank you for making the changes that can be made to help
Thanks.
out.
Thank you.
All right.
All right.
Motion or?
We need a motion to adjourn.
Second.
All those in favor?
Aye.
Any opposed?
Thank you for coming.
Thank you all for
Seriously,
coming.
thank you for coming.
Not too bad.